on the call.
I'm here.
I don't know if Landry or Brooke, I can never tell their number. And then Lindy. I think Lori, is that Lindy?
It's Lindy. Yeah, this is Camille. I don't know her number either by heart yet.
Okay.
So we might want to call them out, President Thomas, and
Okay.
see if, because there's just quite a few people, I agree, in the room. So that might be more efficient.
Okay. All right. Okay, so this is Greg Thomas, Board of Health President.
This is Morgan McMillan, board member.
There's Lindy.
Hello.
Hello, Lindy. Welcome to the board.
Thank you. Can you guys hear me okay?
Yes, perfectly.
Great.
And let's see, Brooke or Landry, are you on? Okay, well, we do have 3, so we do have a quorum. So if other board, okay, Brooke, I see that you just joined. Please introduce yourself.
Brooke Harrison, board member.
Okay, so we've got 4 out of our 5 board members present, so we do have a quorum. When Landry, if you're in, you can announce yourself. This calls to order an emergency meeting of the Boulder County Board of Health. Boulder, or the members have introduced themselves. We do have 4 in attendance. And so that does mean we have a quorum. And this emergency meeting of the Boulder County Board of Health has been called to order at the discretion of Executive Director Camille Rodriguez. Notice of this meeting was posted on the Board of Health's website, and teleconference ID was presented so people could participate because due to the current COVID-19 pandemic and the need for social distancing, these meetings are being held telephonically via Teams. So it is now 5:02. Who wants to take the first agenda item?
President Thomas, one of our attorneys, Kate Haywood, is going to lead on the very first item for us. So Kate, if you're on, go ahead, please. Thank you. Hello, Kate.
Thank you, Camille. 1 second. Okay. So with respect to agenda item number 1, today's agenda includes presentations and participation by several public health agency partners. Because we want to be respectful of agency partners' time, Public Health is requesting that the board approve to moving to a public comment today to after staff and partner presentations. Because of the logistics of a virtual meeting via Teams, we included as part of the posted agenda for this meeting a requirement that all members of the public who wish to provide public comment sign up in advance prior to start of the meeting. This will allow us to call upon each individual in turn rather than attempting to identify individuals based on phone numbers or other information presented on Teams, which may not be accurate. When it comes time for public comment, if approved, the board will call upon each member of the public who has signed up in advance, and each person will be allotted 3 minutes to speak. And we have also provided an option for written comment to the board for those unable to attend. So if this revised public comment procedure is of interest to the board, I would request that somebody move to approve this procedure for public comments for this meeting.
This is Brooke Harrison, and I move to approve the change in the public comment process.
This is Morgan. I'll second.
Okay, we have a motion and a second. All in favor? Aye.
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 Okay, Landry. We do have Landry Fagan, our final board member on. So good evening, Landry.
Sorry about that. I was having trouble getting into the meeting.
Yeah, that's okay. All right. So now we have the staff presentation for item 2 on the agenda.
Thank you, President. We have several staff here this evening. I'm not going to name them all, but you're very familiar. I think, I believe Dr. Nolan is going to provide presentation this evening, although so many people have been preparing for this that I might be speaking out of turn as to who's going to start. So I'll turn it over to perhaps Dr. Nolan to begin. And then I know many of our staff might be jumping in to this very robust presentation for the Board of Health and the community. Dr. Nolan.
Thank you, and good evening, everyone. Thank you for taking this meeting. We're happy to be here today to be able to address what we are seeing as a surge in our community of the COVID-19 virus. And we'd also like to welcome our newest Board of Health member, Lindy Hinman. Welcome. We're here to ask you to pass a public health order to require universal masking in public indoor spaces in Boulder County. As the pandemic continues on, BCPH is moving from a reactive response to a more strategic response that will support the community over the long term. And this public health order is an important step in that direction, as well as to respond to the continued surge in cases that we have seen nationally and here in Boulder County over the past 6 weeks. This evening, we'll provide an update of data and situational awareness about where we are with the virus, what we're seeing in the community, briefly describe the longer-term strategy and trends and how this proposed public health order fits into that strategy, present the public health order draft, and hear from some of our community partners that we've been working with to develop this order. So first, I'd like to turn the presentation over to Michael Wu, our newest epidemiologist, who will provide a data update. Give me just a moment, Michael, please. There you go.
All right, thank you. So good afternoon. My name is Michael Wu. I'm an epidemiologist for Boulder County Public Health. I just wanted to present some of our COVID data to give you some context here. Advance, please. So first, according to the CDC transmission metric, we're currently at 136.42 cumulative cumulative cases per 100,000 in the last 7 days. Now that puts us in the high transmission category because we are over the 100 total cases per 100,000. Next. So Boulder County, we're not an isolated county. We are part of a larger metro area. Now what that means is that people might reside in other counties and they come in to work or conduct other activities, and these other counties, they might have less restrictive measures. So it's a good idea to keep an eye on these other counties to see what the trends are. Next one. So currently, the orange line is showing where we are this year, and the blue one is the same time period last year. Now, what this is showing is that our current cases are higher than what they were at the same time last year. Now, this time period is right before the fall surge that we saw in November, and what this could potentially mean is if another surge happens this fall, that we're already starting from a higher baseline. Next slide. So yeah, this is just a breakdown of our cases broken out by age. Overall, we're just seeing that the trends are going up. Some age groups in particular are especially increasing, but there are some others that we are seeing that are also stable over the last month. Next one. So what this is showing is this is the average number of actual cases that we're getting per day over the last 7 days. So currently we're averaging about 58, a little over 58 cases per day over the last 7 days. And what this orange line is also showing is limited epidemiological capacity. Now, what epidemiological capacity is the ability for our epi team to conduct full case investigations for each new case of COVID-19 among our residents. Now, when we reach above this capacity, case investigation and contact tracing activities, they do continue, but they're more strained. And that also means that the amount of follow-up that can be conducted with each case is more limited. Additionally, and this is considered what we're calling surge as well, surge conditions. And when that happens, our prioritization is going to be among our early childhood education as well as our K through 12 cases. Next one. And this is showing, that we continue to see the Delta variant to be the predominant variant in our community right now. And additionally, the Delta variant we do know is at least 2 times more contagious than the previous variants that have circulated around the country as well as our community. And additionally, Delta variant, in this pink bar, it wasn't present in our community during that November surge. So, if this surge happens and it's fueled by Delta, it could be potentially much worse going into the fall. Next slide. Additionally, we are seeing that our testing positivity has increased slightly from 4% to about 4.2% week over week. This is actually slightly encouraging to see that we are under the 5% testing positivity metric that's also on that CDC table for their transmission categories. This could mean that our community is doing a very good job in terms of getting themselves tested when they might be exposed to someone they know who has been positive, or they're seeing symptoms. Additionally, we are seeing an increase in the number of tests that are being done. So, we went from about 1,100 tests per day done a couple weeks ago, and now we're currently at about 1,600 tests. And then with CU, starting their academic year, we are starting to see more and more of those cases coming in among the CU affiliated. That means their students or their staff. So, just another thing to consider as, people might be exposed outside of Boulder and are coming in, for classes and stuff. Next slide. Now, when we're talking about hospitalizations and deaths in Boulder County,
Sorry, Michael,
you can go to the next slide.
Sorry, Michael?
Yes.
Sorry, this is Morgan. Before you move on to hospitalizations, can I ask, does the county have clear data on breakthrough cases? When you look at total cases, how many of those are breakthrough? And I apologize if that's coming further into your presentation.
No, that's okay. Thank you for asking. The thing is that with breakthrough cases, there's some additional adjustments that need to be done to be able to compare our data, especially statewide. And this is one of the things that we're actually waiting on the state to provide guidance on how to do those, analyses to be able to look at it. I don't know if that answers your question, though.
Is the data currently being collected? I know I read that the state is now going to mandate collection of that, but I didn't know if we had good data that showed. I mean, I'm looking at your numbers around age demographics, and I know that our rate of vaccination, for instance, among 65 plus is very high. So I'm wondering, as those cases go up, are those primarily breakthrough infections, or are they the small percentage of 65 plus people in Boulder County who aren't vaccinated who are getting COVID?
Yeah. Go ahead.
This is Indira. I'm going to talk about breakthrough vaccinations when I cover vaccinations. But Michael's right. We are still waiting on the state to release a data dashboard for local public health agencies. And standardizing through the state is really important. We have to do age adjustments and make sure that the rates that we're presenting are in line and consistent with how it's done in terms of best practice.
Okay, great, thanks. I will wait then,
Yeah.
Indira, for your comments, but I guess I'm just trying to get a sense of if we know like trends or if we have an idea of things even without sort of official data.
Yeah. No,
Yeah, just to,
This is Amy Meditz
to
from Boulder Community. There we do have some data, and I can, when I speak, I can give a little bit of what the direct hospital experience is.
yeah, this is Brooke, board member. That would be much appreciated, since I know that several other states do have this information and have been tracking it closely. And it is important, especially when we're being asked to make more moves, when we can question, we need to know, is the vaccine just not working? Or is it that we have an unvaxxed population that's spreading this rapidly? So it's an important question to answer when we're looking at passing more public health orders.
The answer to your question is both. Both of those things are going on, and it's causing this surge.
Okay, but I think we would really like to know what the actual percentages are that we're looking at.
Okay, I'm going to ask that we continue to move on in this presentation. Write down your questions, and as we end each one, if it's something that has been touched on but not brought up or explained in detail, then please ask your questions. But I would just want to keep the pace moving on this.
thank you. Yeah, you can advance the slide. Okay, so what this slide is showing is basically our north central region. So these are 10 counties, including Boulder County. And what it's showing is, since the beginning of July, that we are starting to see an increase in hospitalizations. An average of 56% of our critical care ventilators were available, and it was down from 60% last week. But additionally, I think what we're seeing here is that with hospitalizations going up, the context is once again different. We're also seeing staffing shortages as facilities are seeing ongoing attrition, also difficulties with hiring qualified nurses. So although the hospitalization numbers is not as high as it was in November, it's still something to especially be aware of as we're starting to go into the fall. And then specifically for Boulder County, currently, just as of an hour ago, we have 53 people that are hospitalized with confirmed COVID-19. And that is in comparison to 42 people that were hospitalized last week. And then also just, specific to pediatric numbers, we have 11 that are confirmed COVID hospitalizations among the 4 children's hospitals, and 25 that are persons that are under investigation. Next slide. Okay, so, there was a period of time when, from the beginning of June into middle of July, that we were not seeing any deaths in our community, but now we're starting to see a few more deaths coming about, and majority of these are coming out among our long-term care facilities as well. And that's it. That's it from me.
Okay, this is Indira Gujral. I'm the Division Manager for Communicable Disease and Emergency Management. I'm going to talk a little bit about COVID vaccinations, third doses and boosters, and then also I'll spend some time on the breakthrough cases and what we're seeing. So, next slide, please. As a state, Colorado is doing well with vaccination efforts. Among those eligible for the vaccine, which are individuals 12 and older, 73.1 have received at least 1 dose. Next slide. On August 23rd, the FDA gave full approval of the Pfizer vaccine for individuals 16 and older, and this new brand is called Comirnaty. And it should be noted that Pfizer doses for 12 to 15-year-olds are still under emergency use authorization. And on August 13th, CDC's ACIP advisory board also recommended an additional dose of Pfizer or Moderna for moderately to severely immunocompromised individuals at least 28 days after completion of the first of the doses that they've received. There is currently no recommendation for additional doses for individuals who have received the J&J vaccine. And so I just want to point out that there's a difference between getting an additional dose. If you're immunocompromised, we are calling it the third dose, and that's different from boosters. We're waiting on guidance from the FDA and ACIP for booster doses, and this should come probably in mid-September. And we may be looking at offering, it's just important to recognize not everybody may be getting the booster dose. It may be offered just for those with high-risk profiles, such as those that work in healthcare, long-term care facilities, and older age groups. And we'll be soon in mid-September. And right now, there's no specific timeline for the COVID vaccine becoming available for less than 12 years of age. We're estimating it's going to happen probably in fall or winter. Next slide. And just some brief data on our local data. Next slide.
Did you enter that thing that's Trippin' Susan as low as Stern? Just change another note.
I haven't yet, I will.
If everyone can mute, that'd be great. Thank you. Among the total population of Boulder County, 72.7 are vaccinated. And we have seen significant increases over the past month, particularly among our 12 to 14-year-olds. And this age group were at 71% on July 27th, and they're now at 79%. So that's a significant increase, which is great. And almost all the other age groups continued to increase, with those over age 25 years of age, over 80% of them have at least one dose. The concern that we have is we're seeing less movement among those who are 15 to 19 years of age, who only slightly increased from 59% to 62% since July 27th until now. And similarly, we're seeing this also in our 20 to 24-year-old age group, who went from 55% to 57%. So our vaccine teams are really focusing on these younger age groups. Next slide, please. I just want to point out the numbers in terms of the unvaccinated. So approximately 89,500 people, or 27% of our county residents, are currently not vaccinated. And this is either because they're ineligible and they're, children under age 12, or they've chosen not to get the vaccine. And approximately 35,000, and just taking a closer look at the school age kids, 35,000 Boulder County school age children, 5 to 19, are either ineligible, and that number represents, 23,500, or unvaccinated. And that represents, out of all of the 89,500, this represents 89,000. It represents 40% of the total unvaccinated population. We're also seeing some disparities still among unvaccinated children, 12 to 19 years of age. 40% are children of color. So we are working with our community ambassador program to increase and get the word out as much as we can. Next slide, please. The average number of COVID vaccination doses does seem to be increasing. It's now at 527 per day. And this is higher than last week, where we were at 448 per day. Next slide, please. So right now, Boulder County Public Health is continuing to promote and offer first doses, as well as third doses to immunocompromised individuals. And we're doing that predominantly at our Longmont Hub Center. We have some community outreach that happens at the local food pantries and some other spaces. We're also coordinating and planning for booster shots with our healthcare enrolled providers. So they have been significant partners in helping us to get the community vaccinated. And we work closely with our 6 community ambassadors and many other local partners in preparation for this FDA approval. And we're also supporting local businesses and municipalities and individuals who are wanting to mandate vaccinations in the employment sectors, and we're sharing policies. Next slide, please. So I'm just going to touch briefly on some data from the COVID vaccine breakthrough cases, because I do think it's relevant to this conversation, and I think everybody brought that up, so that's great. Next slide, please. So a breakthrough is someone who gets COVID-19 and is infectious at least 14 days after receiving the recommended vaccination. Breakthrough cases are expected. No vaccine is 100% effective at preventing illness, but we know from some of the research that I'm going to present here that it also helps to prevent severe illness, hospitalization, and death. Next slide, please. So I wanted to share this most recent Morbidity and Mortality weekly report. Some of you may have read about this. This was data that came out of LA County. And the researchers in LA County, what they did was they linked the COVID surveillance, like the infectious, the cases, to the vaccine registries for individuals 16 and older between the period of May 1st and July 25th. And there are two figures here. The top figure shows the case infections, and the bottom shows the hospitalizations. The dashed line represents the unvaccinated, and the solid blue and the smaller dashed blue represent the fully vaccinated and partially vaccinated individuals. The results of this population-based analysis of 43,000 individuals indicates that by July 25th, which is the last day that's seen here, the infection rates among unvaccinated persons were 4.9 times higher than the vaccinated, and the hospitalization rates among unvaccinated were 29 times higher as compared to those that were fully vaccinated. What this tells us is that vaccinated individuals are less likely to have severe illness requiring hospitalization and may only experience mild symptoms, but there are some, demographic trends that we're going to talk about in a second that we have to be concerned about. Next slide, please. Okay, so this is vaccine breakthrough data that is from Colorado, and it is starting to show some similar trends. And the state is slowly releasing and analyzing their data, and I'm hoping that they'll run an analysis similar to what LA County did. This data shows that the percentage of vaccine breakthrough among cases, hospitalizations, deaths among cases, and then deaths due to COVID. And that just means that COVID is the underlying cause of death. The data is presented with 4 time periods at the top. So you can see January 1st through July 24th. That means that's the whole, it's a main time period. Then April 1st to July 21st, July 1st to July 24th, and then the last time period, which is July 25th to August 8th. So the reason why they did these different time periods is to demonstrate the changes in vaccine breakthrough to pretty much due to the predominance of the Delta variant, which, as Michael said, is 2 to 3 times more transmissible than the Alpha variant, which is what we saw predominantly in the spring. So if we look at the most recent data, which is highlighted in yellow, we see that among all the cases, so that's that first row, 74% are among the unvaccinated population. Among the hospitalizations, the unvaccinated represent 83% of all the hospitalizations during this time period. And among the deaths, the unvaccinated represent 75 to 80% of all COVID deaths. So the data really does demonstrate that even when facing the Delta variant, which is 2 to 3 times more transmissible and can be more severe than the prior Alpha variant strain, that the unvaccinated are the most impacted by COVID. Next slide, please.
Indira, can I ask a quick question on that one?
Sure.
Did they happen to break it out by age group as well, or is it just that high level?
That's the next slide. Yeah. So we're going to talk about ages. So they haven't broke that specific data out by age group, but we do have some preliminary data. So from some of the cumulative data they've collected. So while vaccine breakthrough cases represent a small percentage of overall cases and hospitalizations, the preliminary state analysis of Colorado vaccine breakthrough cases has identified that there are some disparities and some trends. So among the vaccine breakthrough cases, so we're just talking about vaccine breakthrough, 53% of the breakthrough cases are among individuals in their 20s, 30s, and 40s. And this is actually very similar to what we've seen with COVID, right? These are populations that throughout the pandemic have had more frequent exposures often due to employment or social gatherings. Sometimes they have young children who can't get vaccinated. And then among the vaccine breakthrough cases who are hospitalized, the preliminary data is showing that individuals who are 60 and older are disproportionately impacted. 78% of the breakthrough hospitalizations are among individuals 60 and older. So while we don't know for sure, what is causing this, we are saying that, possible contributing factors may include possible waning immunity or lack of effective immune response to the vaccine. So I hope that helps to give you some idea. And we're hoping that the state will start to break this out instead of using the cumulative data, but also break it out as they broke down the cases, hospitalizations, and deaths. Next slide, please. So the key issue here is that, vaccines save lives, vaccines. We know that there's enough research out there to show that it reduces the rate of symptomatic COVID, reduces the rate of asymptomatic, it shortens the duration of infection, and reduces the proportion of viral load. And what we know is that when someone who has been vaccinated gets COVID, their viral load will, in the beginning, be the same as the viral load as someone who is unvaccinated. But what happens is the antibody response is really rapid, and so we know that the viral load will decrease precipitously in a shorter period of time, often in a few days. Next slide, please. So what the data that Michael presented and I presented today is telling us is 5 different things. First, it tells us that we're doing a good job with our testing and our transmission is being picked up, which is really important because it is important to make sure we're identifying those infectious cases. Second, the case data is telling us that the community transmission of COVID is ongoing and rates are rising. And we know that the Delta variant is highly transmissible, and social factors such as indoor gatherings, lack of social distancing, and not having mask policies actually plays a role in leading to more transmission in our community. Third, our epidemiology capacity is being exceeded, and we know that performing case investigation and contact tracing is one of the main evidence-based strategies to control community transmission. Fourth, while we're making significant strides in getting more eligible people vaccinated, we still have 66,000 individuals who are either ineligible, 66,000 people who are eligible and unvaccinated, and 23,500 children under the age of 12 who are ineligible to be vaccinated. So what we're recommending is another layered mitigation strategy is needed in our community to lower community transmission rates. That's it for me. Next slide, thanks.
Thank you, Indira. I'm Lexi Nolan. I'm the Deputy Director at Boulder County Public Health, and I'm going to talk to you a little bit about what our longer term strategy is so that we are really able to get ahead of this virus going forward, and how the public health order that we are proposing tonight fits into that strategy. So just a reminder, we have 3 North Star goals that we believe really capture a wide swath of community interests related to the pandemic. The first one is really about preventing severe illness and death. We know that the Delta variant is more transmissible than the original. And we also know that we've still had, in terms of deaths, we have 12 deaths in Boulder County during the second and third quarters of 2021. All but 1 were unvaccinated folks. In a little better light, our death rate in Boulder County is about 78 per 100,000 over the course of the pandemic, compared to a U.S. average of about 188 per 100,000. And we believe that part of that lower death rate is because Boulder County does a good job of responding quickly to what we see happening in our community and not delaying and waiting until things are as out of control. And that's helped us keep our death rates down and our case rates down over time too. In terms of hospitalizations, the state of Colorado is now expecting the peak of hospitalizations to be in December. And we are seeing patients go into hospital who are younger and sicker than with the original strain. In terms of severe illness, we know that about 1/3 of cases have long-lasting effects, and that there have been about 4,000 cases and 37 deaths from multi-inflammatory syndrome in children in the U.S. The key message here is really that we need to continue to increase vaccination rates and reduce cases to support this goal.
Hey, Lexi, this is Greg.
Yes.
So the forecast for the peak is from School of Public Health or CDPHE?
It's from CDPHE, perhaps working with the school. Indira, do you have the details on who did the original research on that? I know that CDPHE has presented that.
The state has a contract with the School of Public Health out of Anschutz. It also includes, I believe, representatives from CU Boulder, CU Denver, CSU, and they work collectively to build the modeling that is provided, I think, almost weekly or biweekly.
Okay, thank you.
And just in relation to that, I think one of the more sobering facts related to that peak is we're expecting to see 100,000 more deaths in the United States by the end of December, and those will be almost entirely unvaccinated folks. So our second goal is to not overwhelm our health system for so many reasons. We have to understand first that it's a system that when we look at this issue, we can't look at individual hospitals or pretend like Boulder County's hospitals are isolated from others. Our hospitals work with collective response to wherever needs are. They serve patients beyond our county and they serve needs beyond COVID. As I mentioned, the hospital rates expected to peak in December. Our Boulder County hospitals are already in an emergency transfer situation where they are diverting patients to other counties, and non-emergency procedures and surgeries are being delayed at some hospitals. And finally, we often use the metric of beds and availability of beds and ICU beds, and those are at critical levels in many of our hospitals now. But we also need to pay attention to some of the staffing challenges that hospitals are experiencing, and for some, they are severe staffing shortages. Just a reminder, public health is part of the health system, and our staff is now in surge response protocols in relation to case investigations and contact tracing. So key message, protecting our health system doesn't just help with COVID, it's critical to supporting a healthy society. Our third goal is really one that I don't think anyone would disagree with. We really want to return to safely return to normal activities. And people may have, different specific ideas of what normal or pre-COVID important activities for them were, but we think a good way to kind of summarize that is really, it's about minimizing disruption and burden, that it's about keeping kids in school, keeping businesses open, and keeping community and social cohesion opportunities in place. We know that there are mitigation strategies that are really critical to being able to safely return to normal activities. Some of these need to really be sustainable and habitual strategies. Those might include vaccinations, hand washing, ventilation, testing when symptomatic, and others are more cyclical strategies that we need to apply to course correct or anticipate challenges. And those might include other kinds of interventions like masking or social distancing. The key message is that when case transmission is significant, we need to use more mitigation strategies to maintain normal activities and to avoid disruption. Okay, so let's take those three goals that we have been talking with our community partners about and getting input on and refining. And let's talk about what that means in terms of a longer term vision and strategy. First of all, we know that COVID is unfortunately going to be around for a while. It's not going to go away in the short term, and we need to be planning for that. Second, we need to be able to recognize some of the vicious cycles that keep us in a reactionary mode and really begin to support virtuous cycles that help the community to self-correct using a variety of mitigation strategies so that we're really, when we're solving one problem, we're solving many problems. And we think we have some ways of doing that. Third, we need to incentivize and support community partners to adopt vaccination policies. And this will help to scale and accelerate vaccination uptake, to support sustainability of maintaining high vaccination levels, and to support sustainability of, and to support incremental and voluntary approaches that allow gradual expansion and time for the community to adapt to rules in public spaces. Fourth, we really want to engage the community in the process of identifying challenges and finding and implementing solutions together. And when we talk about the community, we're talking about the business community, nonprofits, faith communities, governmental agencies, chambers of commerce, community organizations, et cetera. And finally, we really need to be able to support community change in cultural and practice norms and community ownership of responsibilities. And that really helps us to locate the power in the community itself so that everyone becomes agents of change. And what we'll talk about for just a couple of minutes is some of the ways that we are beginning to see that work happening. So too often we have found ourselves being caught in vicious cycles of having a surge in cases and issuing a reactionary public health order, which reduces cases. And then because the cases are down, we relax the public health order. And because we've relaxed the public health order, we then see an increase in cases. And so we repeat the process and we get caught in this vicious cycle that is really makes everyone unhappy. Not least of all the health department. And what we really need to do is move to a virtuous cycle. And vicious and virtuous cycles are terms of art from systems science. But a virtuous cycle is one in which instead of kind of this negative feeding off of each other, the different steps in the process actually reinforce movement towards strength and positivity. And so this virtuous cycle would begin with really encouraging and embedding habits and creating incentives for the community to adopt long-term strategies and institutionalize those long-term strategies and practice them regularly. And that can help reduce cases, but that because those habits have been created and those strategies institutionalized, there is this legacy and normalization of doing that work, and that provides the community the power to self-correct when it sees cases rising, and that would then lead to ongoing low cases with only occasional interventions. And so you kind of have that positive feedback loop back to reduced cases. And so just as an example, if we as a community got into a habit of putting on our masks when we're in public indoor spaces, when cases are high or in substantial transmission, if we did that on our own without a public health order, that would be a great example of kind of a normalized habit that becomes institutionalized and practiced and part of our culture as a community. We wouldn't need necessarily a public health order to do it. People would do it on their own. They would kind of be able to be much more adept at moderating the cases and not having these wild swings that we see. So this first step of encouraging habits and incentivizing community adoption of long-term strategies is really the toughest part to get through, right? So let me just give you a little bit of our thinking about how do we begin to do that. First of all, we do have to find agreement on what our shared goals are. And we've started that process. And you've heard our three kind of North Star goals about preventing severe illness and death, protecting our health system, and safely returning to normal activities. And if we need to refine those goals as we go on, we will do that. We also need to use public health orders judiciously and strategically to support that building of habits and ongoing course correction. So for instance, if we develop a public health order that says, you know what, as a community, whenever we are in this level of transmission, we need to be wearing masks. And we create a habit, we jumpstart that habit with a mandate, but then the expectation is that we really are asking the community to internalize that practice themselves. The third step is really embedding power for self-regulation in the community as much as possible. And so examples of that might be providing supports for low burden mitigation strategies. So for instance, helping restaurants to develop inexpensive ventilation. Ventilation can be very expensive for small businesses, but there are inexpensive ways to do it. We should be helping them to prepare for winter in that way, right? A second example might be helping employers to create policy supports. So for instance, staff vaccination policies, or even voluntary passports if they want to go in that direction, if they feel like that's something that their client base would be happy to feel secure in their space, then that would be a great opportunity for them to be able to do that. And sometimes they need a little support to get that going. And third, to ensure that the public continues to have access to ongoing information and data so that they have the information at the right time and the right place to make decisions and to invoke those habits and adjustments that they need to make. And finally, to support solutions that meet the community's self-defined needs. And these are all things that public health is prepared to engage in as part of our longer-term strategy for really embedding those habits and community adoption of long-term strategies to help get us into this virtuous cycle. So everyone loves this slide because I think we just all love Swiss cheese, right? But what it's really about is the various mitigation layers and how they really work effectively together. There is no one mitigation strategy that is going to be the be-all and end-all to protect us. Vaccines, masking, quarantine and isolation, physical distancing, masks, cough etiquette, touching your face. These are all important layers that are variably important, more important in some situations than others, and that we have to really be able to both use adeptly, use the right mitigation strategy at the right time, and also to recognize the value of layering them on each other, since none of them is perfect. And the other thing that I think is really important to think about in terms of the layered mitigation strategies is that some of these mitigation strategies are a lot easier on us than others. And what we really want to do is we want to be in the habit, in the practice, and have these expectations of each other for using these less burdensome mitigation strategies over on the left side of the screen, so that we don't have to ever use those burdensome mitigation strategies that nobody wants, including public health, that are represented on the right side of the screen. So we think that if we can really do a good job applying these mitigation strategies, that it would be very rare that we need to go back into this space again. And so what we're saying is that even if cases were to rise, if we have a practice of using these less burdensome strategies, then we should be able to continue to go to our places of business, to gather, to meet with friends, all of those things that we really love to do together. And, because I love color coding, I represented the blue strategies are ones that are largely under the, control of an individual. Any individual could do them. Purple ones really are things that we need people to be doing together as a community. And some of those red ones are things that, nobody wants to do. And so they really expect the government to step in and make those decisions. So what are we doing in terms of action towards this vision? Well, first of all, we're going to ask at this moment for a public health order for universal indoor masking because, number one, it is recommended by the CDC for our level of case transmission. The CDC recommends that when counties are in substantial or high levels of case transmission, that they implement universal indoor masking. And we also know that masking mandates are effective. And this is a very small sample. I'm not going to go through all of the details of the information, but we know that mask mandates have been shown in the peer-reviewed literature to be effective. One study of the effective mask mandates that were issued in 15 states over just a month and a half was estimated to have averted over 200,000 COVID cases. We know that it affects decreases in cases and death pretty quickly, even within less than a month, and that in many cases it can be a substantial reduction. So if we also think about kind of where we are as a country, we also need to recognize that there are a lot of other jurisdictions that have already reinstituted universal mask orders, including a number of states, a number of cities, San Juan County in Colorado, as well as a number of large businesses. You are required to universally mask indoors in these places. I want to talk a little bit about how masking and vaccination policies can work together. We presented to you all recently information about why folks who are vaccinated still need to mask when they're around folks that are unvaccinated. And it has to do with that capacity to be a carrier of the Delta virus and the vulnerability of unvaccinated folks who are exposed to that Delta virus and the severity of the impact that that exposure can have on them. At the same time, we know that if everyone is vaccinated, that those interactions are significantly lower risk for everyone. When both people who are interacting are fully vaccinated, the emerging science suggests that they're less likely to develop an asymptomatic infection, less likely to develop a symptomatic infection. If infected, they have a peak viral load for a shorter period of time, as Indira was explaining earlier, and a lower probability of viable and infectious virus. Vaccinated people are not contributing substantially to outbreaks. They can occasionally spread the disease, particularly to unvaccinated folks. But in places where masking isn't even possible, like in restaurants and bars, universal vaccination is really an essential direction for us to begin going. We see an opportunity to offer support for employers to begin to develop their own vaccination policies for staff that would answer that particular need. So the kinds of advantages that those kinds of policies provide are that they create safety for employees and customers. They help to scale vaccination uptake more quickly because it becomes part of the requirement of employment. It helps to normalize community expectations for the longer term, as opposed to a public health order, for instance. And we have seen some public health orders requiring vaccinations, and they typically affect a very narrow group of folks. And this is an opportunity for lots of businesses, if they feel like it's appropriate for them to adopt vaccination policies, they could do it in any sector that they work in. It has broad application across the population, I was just describing. It protects the workforce and keeps health costs low. We are seeing that estimates for hospitalization for a COVID case are between $35,000 and $40,000 per case right now, which can be quite significant. In fact, Delta Airlines recently instituted a policy whereby employees who refuse to get vaccinated are charged an extra $200 a month for their health premium. These vaccination policies can be developed flexible flexibly to meet various needs. There is no one size fits all for how the policy works, and different kinds of adjustments and adaptations can be made for particular groups of employees. And it creates a sustainable system for maintaining high community vaccination levels. So whereas a public health order will come and go, an employer vaccination policy will catch new employees coming in. It will incorporate addressing the need for boosters over a period of years and things like that. Now, there are some considerations with that kind of an approach. One is that, you need to see early adopters in sectors to build some momentum and to build some comfort and safety, prove the concept, learn some lessons, and do some pilots. And I will show you on the next slide kind of where our early adopters in Boulder County are. Number two, we know that not everyone will adopt an employer or a venue vaccination policy, and that's okay. Number three, some businesses will need support to develop and implement policies, also something that we are incorporating into our longer term strategy. And number four, it's important to support employees that you're expecting to get vaccinated. They need accurate information and their questions answered, particularly for groups that may be more hesitant. We need to make sure that we're providing information in culturally appropriate ways, including bilingually. And we also need to support access to vaccines through transportation and time off from work if needed. So let me just show you some of the employers in Boulder County who have already adopted vaccination policies for their staff. We have public sector folks, including CU and CSU. Thank you very much. A number of federal employees. We have a large group of federal employees that work in the Metro Denver area. State employees are now required to be vaccinated. The cities of Boulder, Longmont, and Louisville have begun to incorporate vaccination policies. And Boulder County is leaning towards its own policy. I will tell you, Boulder County Public Health, I think as you all know, did adopt a vaccination policy for staff, for all staff. Our health systems are also now required to be vaccinated as a result of the State Board of Health announcement last week. That is a group of 3,800 agencies in Colorado who are all required to have staff fully vaccinated. We have a number of private sector businesses in Boulder County who also require vaccinations. And we are beginning to see some regional alignment with Denver, Jeffco, Tri-County, and Broomfield are discussing where there might be opportunities to move in this space. And importantly, the 10th Judicial Circuit has also adapted not only a vaccination requirement of staff, but of anybody who is in the building. And that leaves us into, something that's a little bit more maybe not quite ready for most people, but this concept of vaccination passports, which we are seeing a lot of momentum for, including here in the region. These passports have been adopted citywide in a number of cities across the U.S. There are some voluntary vaccination passports that are at the venue level, meaning particular businesses have said, not only are we requiring our staff to be vaccinated, we're requiring anyone in our business to be vaccinated. These are typically used in high-risk settings where masks are difficult for people to wear. So restaurants and bars, gyms, entertainment. And there is there's an emerging tech platform of preference that is being increasingly used in these spaces that would provide kind of transferability in various locations. So we're just going to talk for a quick second. So this is all nice. This is really, thinking forward, thinking through the long term, trying to look out into the future about what this is going to look like. But we also have been doing a lot of work to be kind of present in the here and now in relation to really figuring out what this public health order needed to look like. And we just wanted to share with you some of the groups that we have really consulted in this process and heard from, and folks who have asked for a universal indoor masking public health order. This is a group that we expect to continue to work with over time. And to talk a little bit more about how that will happen and play out, I'd like to invite Lane Drager, who is our lead for the Partner Liaison team, to share a little bit about what we've been working on in that space.
Lexi, can I ask a question about the employer vaccination programs?
Sure.
So first is Boulder Public Health, is Boulder Health reaching out to any companies, or has this all been just on their own voluntary?
The private sector vaccination policies have all been self-developed. We have not been supporting the private sector to do that work to date.
Is there an anticipation of starting to reach out to private companies in Boulder County?
There is, and that's exactly what Lane will be talking about.
Okay. And then also, does the county have a set of incentives or punishments that they can leverage to push for these employee mandated vaccine policies?
So I will let Lane speak to that. I will just say very quickly that we're not really at the point where we're intending to require staff vaccination policies, but we're really in a position where we're hoping to support that to evolve. But if we could let Lane do his presentation, and then we are happy to continue to answer questions.
Thanks, Lexi, and good evening, everyone. So as Lexi mentioned, we kind of initiated the effort to begin reaching out to our community and in anticipation of this board meeting. So wanted folks to have as much advance notice of the things we were thinking about, let them know where we were at. The data that you've seen tonight is information we've been sharing amongst, a whole host of community groups. And we wanted to reach out with groups that we had been working with over the past year, even when COVID was different than what we're dealing with now with the Delta variant. So a number of the groups are listed on the slide, but we've begun that effort in August and are continuing that on now. So a number of folks that we've met with and that are continuing to engage with as we talk through the steps we need and really get that input from them. As you might imagine, this even a phase of a mask, while it's not as invasive as shutdowns, it is going to have impacts across our community. So we want people to have advance notice as well as hear about those nuances that they're going to be dealing with. Next slide, please. So our partner liaison team is something that we did stand up earlier on in our response to COVID. It was sunset when many of our orders went away in June, and we are now reviving that again. So the real purpose is to make sure we're getting information out to our community. It's a very proactive effort to educate, give resources to our community partners. And as we look at potential public health orders, making sure, again, they have that information and the tools to be successful, answering the many nuanced questions that come up. But we can collaboratively plan and prioritize where we're going to be going, really looking at how we protect our community. I think that idea of keeping a normal life is obviously very important to our community. So that is where I think we have the most alignment. And the steps we can take that have the least intrusiveness to their world are important for us to do as best we can to stay in that world. But at the same time, we know we're seeing surges. We know we're seeing very different impact of the disease than we saw last year. It's impacting younger groups, and it's more severe. So it is important that we look at continued strategies, but we need to have buy-in as well as implementation within the community. Lexi's really talked about, we have seen proactive efforts in our community, and we really want to continue to empower that and promote it. We've already met with some of the organizers within the business community, and we'll continue to do that. Another meeting even tomorrow to talk to them. They have a very good pulse on what's happening. They have a lot of thoughts and insight on what the impacts will be. Obviously, this mask order will still have business impacts, especially for those that are even closer to counties that are not doing the same kind of effort. So we understand and we know that we want them to still be successful. The faith community, is an important group. They are leaders in our community, as well as groups that host lots of events and lots of activities. Their congregations meet, and often indoor, especially as the weather, gets colder. So we really won't know that those are important communities to engage, as well as make sure that they have the tools to not be locations where disease is spreading. Continuing to work with other community groups, specifically thinking about our parks and recreation facilities, who, again, another setting where there's a lot of our community and hosting activities that oftentimes may have higher risk for transmission. Currently, we've built out the team. As of this week, we've hired some additional staff. Kelly Hinch and myself are working right now to lead the team and continuing to provide that support to our community. So we'll be doing additional outreach, as well as, if there's a public health order put in place, making sure we've shared information, and then we will have responsibility to make sure that the order is implemented. So there will be that effort to investigate complaints and potentially do enforcement activity. And so we also have legal support from our county attorney's office, which has been invaluable. Next slide. So kind of looking at, again, in terms of how Lexi also painted it, where we're at for our intermediate and long-term efforts. We're coming to you now to ask for support of a public health indoor mask order. We already have a mask order addressing a lot of the child settings where child programming activities are taking place. We do know that there have been a fair number of complaints about the level of compliance of that public health order. So we know that this is an important step at preventing disease, and we're going to need that ongoing support for those public health order implementation. We want to do the partnership. Lexi talked about the value of vaccination policies and working, again, proactively within our community to get those implemented. So I think there are opportunities, as the board brought up, how we can further incentivize that. And so the draft order that is going to be shared with you has the program where we can provide exemptions to the mask order for those folks that have a full vaccination program, where that all their staff and any constituents they work with. And that would be something we would continue to work to implement, hopefully in the next month, with additional input from our community. We also know that we're still facing potential larger numbers, based on the projections that the winter could create additional problems. We know that just the weather alone is going to drive more and more activity indoors. So again, looking at those mitigation strategies that are going to address those indoor risks are incredibly important. So we need to have additional tools to look at that. We also want to make sure that there is that opportunity, that this is a community-driven effort. It cannot be one-sided. This can't be viewed as public health versus the community. This is all of us against a virus. So we really need to have those community-led solutions. We need to support and engage those folks. We need to recognize the impacts that the steps will have, and also try to find as many win-win situations as we can. So it's incredibly important that we have that community buy-in, as well as they're driving some of the solutions that we're looking at. Next slide. The other important pieces that are often pointed out by our community members are, if this county is not doing it and we are, it does present challenges on the economic front, as well as the risks to our community when other folks are not as proactive. You saw some of the slides of the variation across the county, and certainly across the Front Range in case counts, and we recognize that we have bordering counties that are seeing much higher level of disease, and that regional alignment is incredibly important. We have begun conversations. The Metro Denver partners have already been talking and meeting on a very regular basis, but we've also talked on our efforts to work with the business community and other liaison efforts across the region. We want to share those resources and make sure folks have the best tools and knowledge and collective thought. We're all in this same boat. We are working on a regional, we actually have a webinar set up for next week where we intend to try to reach out to the businesses, giving them information and resources, answering a lot of questions about how they can and think about putting vaccination policies in place. There's a lot of questions, concerns, people aren't even sure if they can do it. So we're trying to make sure we give as much resource to them as possible. There are businesses, you saw slides previously that this has been done by a number of folks already in Colorado. So we want to take that collective knowledge and help others be as successful. We're also going to stay very connected to our call center. They are obviously the pulse on what our community is concerned about, what questions they have, the complaints that they're sending, so that we can stay in touch with that, making sure information is disseminated to our community, but also that we are able to be responsive to areas where concern is arising, especially areas that may relate to a public health order and non-compliance. And I think that ends my piece. So thank you so much.
Thanks, Blaine. I'm going to present what the proposed public health order contains. A lot of this has already been foreshadowed by what Lexi and Lane and Indira and Michael have all presented. Next slide, please. So proposed public health order 2021-08 is to align with the CDC recommendations. And just to remind the board of what that is, the CDC on July 27th of this year, in light of the Delta variant, and if you look at that third bullet point right there, that's what I'm referring to, in light of the Delta variant, changed its guidance because of the contagiousness and the infectiousness of the Delta variant, and recommended that all fully vaccinated people should wear a mask indoors in public if you are in an area of substantial or high transmission. Next slide, please. The reference to substantial or high transmission is what you see on this chart. This is a transmission tracker that the CDC implemented several months ago to track community levels of transmission in every single county across the United States. Since about mid-August, Boulder County has been in high transmission. As Michael said earlier, we're about 130 cases per 100,000, which puts us well into the high transmission rate. Next slide, please. I'm just going to really try to put this in context for you. We went back and looked historically how our data lines up with the CDC Transmission Tracker. And as you can see, we snuck back into high transmission in mid-August of this year, but we were actually in moderate and low transmission for most of the summer, which is really great. And all of these peaks that you see are during our surges. So this transmission tracker lines up well with what we saw historically, and the high transmission line also aligns with our epidemiological contact tracing capacities. Next slide, please. So proposed public health order uses very closely the language of the CDC and states that masking is required for all individuals aged 2 and older in public indoor spaces during periods of substantial and high transmission. And there are 2 exemptions for under the age of 2 and those who cannot medically tolerate a mask, which are the same exemptions that we saw in the mask orders last year. And there also are a number of exceptions. Like the K through 12 mask order, exceptions are activity-based, exemptions apply to people. And I just want to emphasize, we're not trying to reinvent the wheel here. We don't want to folks have to learn an entirely new process. So these exceptions are substantially similar to the exceptions that we saw in the spring of this year. The new portion of this order is adding flexibility to businesses who have chosen to implement a mandatory vaccine policy or vaccine passport. And I'll get to this portion at the end after I talk about the mask portion, but the idea here is that this incentivizes businesses to implement such policies vaccine passports or a mandatory vaccine policy for their employees. And in doing so, they can get an exception to the indoor mask order, even during periods of substantial or high transmission. Next slide, please. So an indoor public space, much as it was in the spring, means retail stores, offices, fitness facilities and gyms, restaurants, event centers. And I just want to be clear, this does not cover private residences. There's no mask requirement if you have a friend over from another house. However, Boulder County Public Health would recommend wearing a mask if you are near someone not from your household, particularly if one of those individuals is not vaccinated. Next slide, please. The proposed public health order, very similar to the spring again, would require that businesses post signs stating that mask is required. This helps us get the message out so that the public can help be informed just by walking into a business that masks are once again required. And I want to emphasize, we're already seeing a number of businesses in Boulder County requiring masks of employees and sometimes in employees and customers just on their own following the CDC guidance. Next slide. This is a list of the exceptions to the mask order. Once again, these are activity-based. So if someone is hearing impaired and they need to see someone's face in order to communicate with them, there's an exception there. If you need to see someone for identification purposes, there's a performer exception. If you are performing religious services, or if you're doing a performing arts performance, or you're speaking to a crowd, as long as you're 12 feet away, there's an exception. There's no need to mask if you are alone in a room. There are certain sports that there's an exception for, and this is very similar to what is in the pre-K through 12 mask order. Seated at a food service establishment, performing personal, religious, or medical services, or swimming, or actively engaged in a public safety role. I think the big picture you want to take away from this is that the intent of this order is that we can continue with all of the things that we have been doing over this summer, all of the commerce we've engaged in, all of the activities we've participated in, and that won't be hindered by the order. I see Morgan has her hand raised.
Thanks, Trina. Just quick clarification. Does this apply to private businesses who aren't open to the public? So an employer who does not have a vaccine policy, but does this apply to them, that they don't have members of the public coming and going? It's a closed office?
Yes.
It does apply to them.
Correct. It would apply to an office space that is not open to the public, unless that office space were in someone's private home. Then it wouldn't apply. But you know, if you have an office building in downtown Boulder, it's going to apply there. And that is in line with the CDC's recommendations. Next slide, please. This new portion of the order is this approved fully vaccinated facility. I want to emphasize again, this is a voluntary program. We have seen a number of jurisdictions that Lexi listed that are actually mandating vaccines for certain businesses. And this order is not that, but it provides an opportunity for businesses. I'm sorry, Morgan, did you have raised your hand again? It's popping up.
Nope, sorry.
Feel free to interrupt me if any of the board members do have questions, though. The approved fully vaccinated facility program is going to be a voluntary program as we have it proposed. So it kind of combines the best of both worlds, is we get that protection from indoor masks when you're around other people. But if everyone in your facility is fully vaccinated, the risk is significantly less, and you can get exceptions to that. And it also empowers our community and our businesses and our event organizers to figure out mandatory vaccine policies or vaccine passports that work best for them. And when I say approved fully vaccinated facility, what we're talking about is that everyone in that facility would be required to be vaccinated. So if I'm going to a concert that's a fully vaccinated facility and I'm just attending, I would need to be vaccinated. Yes, Brooke?
So mandatory vaccination policy. So as we heard from CU at our last meeting, there is still the broad exemption of personal belief. So will this be managed in some way or watched to determine how many of the employees are actually being vaccinated and how many are simply submitting a personal belief exemption?
Yeah, that's such an excellent question. And I just want to say, CU is part of the inspiration for this program. And so we're not quite ready to launch this. We would like this to be part of the public health order, but we'd like another 28 days or so to fully delve into the details of what this would look like, because we recognize a facility as large as CU might need to have a personal exemption for various reasons, but they don't have a blanket exception to the mask order. They're still masking in certain indoor spaces, and so they have other mitigation strategies in place. With this program, there would need to be an application process, and a business or facility would say, here's the situations in which we'd want an exception to the mask order. Here's our type of demographics, and here's our other mitigation strategies. And we can look on a case-by-case basis and let the community really help us guide what's going to work for them in light of their demographics and in light of their specific needs.
Got it.
And Trina, this is Lindy, just to kind of follow into that. So are you suggesting that we would be approving this at a general level, but there would be more policy making to come to better define what this really looks like before we implement?
Correct.
Okay, thank you.
And would the staff be leading that then, right? This would not come to the board to make that determination about what this this program looks like. That's staff driven.
Correct. And Director Rodriguez is nodding her head. Of course, if the board wanted us to come and present what the program looks like specifically and give input and feedback, we could certainly do that. But as Lane alluded to earlier, part of the goal of this is to really get in community engagement. So we would like for this program to take into account the feedback that we're hearing from the community and seeing what works best for them as well as for public health mitigation strategies. Next slide, please. Just a little bit more about the voluntary approved fully vaccinated facility program. Once again, this is encouraging policies on a business level, on an event level. Facilities will be allowed to design their own program based on their demographic and based on their needs, but it does require approval from Boulder County Public Health so we can make sure it doesn't get out of control. We need to make sure there are adequate mitigation strategies in place, vaccination being the front and foremost, but depending on the situation, there might need to be additional mitigation strategies. Next slide.
Can I ask a question? That's Greg. Lane, yeah. Would the approval of those plans be part of what that group of 4 people you had identified earlier? Would that be that team that would do it, or would this require additional resources beyond that?
At present time, that's our anticipation. We're not sure what the overall workload of the public health order will be. We have some projections, but yes, we would anticipate handling it within that team. And if we needed additional folks, we would pursue adding additional folks to the liaison team.
Okay, thank you.
Yep.
Yep. And just some high level sketch outline of what this program would look like. Facilities would have to track individuals who come into the facility, because if you're not tracking individuals, you can't know their vaccination status. And there needs to be a policy or system in place to track those vaccination status. And as Lexi mentioned, there's technology being developed. We have City of New York has the Excelsior Pass, which allows businesses to just look on your phone and say, yep, you're good to go, come on in. And the facility has to have as part of their policy that they're actually requiring proof of vaccination. And the state of Colorado has already set up a system where you can put your vaccination card on your phone. I have it on my phone. It's pretty cool. And you'd have to have proof of vaccination for all your staff and employees. If you have members of the public coming in, then you'd need to have proof of vaccination for them. If you're a gym and you want to have your gym be a fully vaccinated facility, you just have to show that your membership is vaccinated. And when they come in the door, you know that because they're scanning their membership card. Next slide. Moving on from the fully vaccinated facility aspect of this order, just some other pieces. We're going to incorporate, as a reminder, the isolation and quarantine guidance from Boulder County Public Health. This is nothing new. It's just in actually pretty nice and usable form so that the folks can see, do I need to isolate? Do I need to quarantine? Next slide. And then the timing. We're asking that this order go into effect tomorrow, September 3rd at 5 p.m. and that the board approve the order with the fully vaccinated facility program written into it, with the understanding that the details about the fully vaccinated facility program will come at a later point, and that Boulder County Public Health won't start accepting applications until about the end of September, and that would allow us time to speak with our business partners and our facility and event organizer partners and get feedback. Yes.
Yeah, so I figured that would probably be the effective date. I guess I just am worried that will the word get out within the next 24 hours, the posting of the businesses, you know, confusion on the public side. I know this is a very important weekend. And so that was really just what I was concerned about, is when would it take effect, and because I would hate for enforcement to, you know, happen on Saturday and people are just still confused about it.
It might be helpful to understand a little more about our enforcement process, because I think that's really important. Our enforcement focuses first and foremost on education. So if there's a lot of enforcement going on over the weekend, should the board choose to pass the order, it would initially look like a lack of education. Hey, there's a public health order passed. Can you please put up a sign and require masks? And, you know, we really don't get to the penalty portion of a public health order until someone has willfully violated an order and is actively defying the requirements. But our enforcement team historically has spent an enormous amount of time talking with businesses and educating them and helping them understand the importance, and really making a partnership there instead of just trying to come down on folks where we see one little violation.
Okay, that seems reasonable.
Hi, Trina, this is Lindy again. So you're talking about the duration of the order, and this is a question I had before this slide. So, and apologies if this is covered before, I just need some clarification. So the policy, I think, is saying that we will apply this during substantial or high transmission periods. So what is the data lag that necessitates sort of continuing a public health order like this until we know that that we are below that line?
So the way we have, that's a great question. The way we have the order written is once we reach 21 days sustained in moderate or low transmission, the public health order will automatically release the mask requirement without any action from anybody.
Great.
And then what the duration of the order is at the bottom of this slide is we'd like to keep the public health order in effect for long enough that our hospital system is, well, I should probably let Camille speak to that part actually.
Okay, great. Thanks. So this is a different policy than the 21-day. Okay, thanks for that clarification.
Correct. Yeah, the 21 days is written into the order, and so let's say the order stays in effect for, you know, X number of days beyond this. We could come in and out of the mask requirement as long as the order is in effect. So if we go out of the mask requirement because we're just doing great, then that's great. If the order is still in effect, if we have 5 days in high or substantial transmission again, masks would automatically be required again.
Okay, thank you.
And the recommended duration here matches the duration of the school mask order, and that's why we have it drafted that way, but I can let Camille speak more to that.
Thank you, Trina. I mean, I think you did an excellent job clarifying. We didn't want confusion, and I think the membership here is asking questions that are spot on, that perhaps their constituents and the entire community are hoping you would ask. We don't want anyone to be confused, and we also want the order to reflect what we are seeing in trends. And so as we explained, staff explained to you, we are concerned about winter coming. We want this order to be agile, but also to reflect when we are in low or moderate transmission. And so definitely we thought through those places and spaces, and thank you for asking those questions and allowing us to clarify.
I think we can move. Oh, Morgan has her hand raised.
Oh, yeah, thanks, me again. Hey, Lane, thanks so much for walking us through the group that you have and the team and what you're planning to do. What I was a little unclear about is, have you talked to this group already about this proposed order? Have we received feedback specific to this order from those businesses and nonprofits and faith communities?
We certainly haven't talked to everyone within each one of those sectors, but we have been hosting efforts. We had a webinar with the business community earlier today, and I did my best to share this kind of draft idea. And I think, you know, the kind of concerns certainly are, you know, the timing, as Greg brought up, so that they have a chance to really let their constituency, their clients know that this is taking place, make sure they're set up. There's not a lot of infrastructure requirements. This isn't as nuanced as the mini orders we dealt with last year. We're not talking about limits on occupancy and spacing requirements and all those nuances. It really gets down to making sure they have masks for their staff, and then they have signage for all the community. And so obviously we need to make sure, as a public information, we get this out, which we've also been preparing to do. There is concern on some of that competition, especially, you know, some of our border community businesses, that if across the street is a different county and they're not asking for it, are they going to lose out on business? And I think some of those are obviously real concerns. But we hope to create a system where our businesses are safer, and hopefully that can also be an incentive to drive our community to them. But, you know, there's not a doubt that this will still have impacts within the community. It's not as invasive as the many orders we dealt with last year, but it will have some of those implications. Our hope and goal is that it's not nearly as intrusive. We don't need to go to those other steps. We don't need to go to closures. We don't need to go to occupancy limits and all the other nuances. But we really think it's important to do that. The faith community is, you know, at least the ones that we talked to last week, many of them were already taking a lot of proactive steps. You know, there are Jewish high holidays coming up, and they're making plans on doing their activities outdoors, having everybody be vaccinated, still wearing masks. So a whole host of, you know, great mitigation strategies, and we gave them some additional ideas. There's others that are very concerned and don't want to see this happen. So it's, you know, you're going to hear the spectrum, you know, across the county. You know, there's I think a sentiment of people who just don't want to have to wear masks, and you know, it's a challenge. I don't think any of us love the idea of wearing masks, but if it's the least benign step we can take to allow businesses to continue to operate, have our kids be in schools, and do many of these activities, we still think it's an important step to do. But yeah, we want to continue to hear from them on what their pain points are, and where we can alleviate them, we will. But we know that there's going to be some that it just is going to be an impact. This isn't the same as the kind of openness that we had over the summer. And it will take that adjustment period. You know, the community, I think, got very used to not having to do many of these things, even though many are still proactively doing it because they know that there is an increased risk.
Okay, thank you for that summary.
I do see member Hinman's hand still up. Lindy, did you have more questions?
No, that may have just been a technical failure on my part. Sorry.
No worries, no worries. If it pleases the board, I know that Trina has gone through her slides. We have several guests with us this evening.
I had one quick clarification.
Apologies. Yes, go right ahead.
Before we move on to the public comment, so considering this public health order, are surrounding counties considering similar orders? Because just like they come into Boulder, we go out. And so if we're going out and there's no mask mandate and we're not wearing masks, it could be an issue.
I'll let Camille respond, but I will just say something historically. After this board passed the PK through 12 mask order and child care mask order, all of our metro counties implemented a child care and school mask order.
And if I may, yeah, Trina answered it precisely as I would have. That generally has been the case. We are leaders in this these types of actions, and so I cannot predict exactly what will happen, but certainly we're hopeful. Any other questions before we continue? I thank you again, Board of Health, for your service this evening. I know that these updates were important for us to impart to you, and this decision is very important relative to this recommended indoor masking order. And as staff outlined for you, this recommendation works to prevent severe illness and death. It prevents overwhelming our systems, and it tends for us to safely return to the activities we love doing. We also told you that we do engage with the community in the process of finding and implementing solutions. And tonight, several of those community members are here to share the work they have done to address the pandemic in their operations. And all of that is to illustrate how our community in a variety of settings is rowing in the same direction, using layered mitigation strategies to support fighting this virus in our community, to increase vaccination rates and reduce cases. I know that several folks hope to speak first. I know that if you recognize faces, you can see Mr. O'Rourke here from CU Boulder, but I'm going to start with Dr. Amy Meditz from Boulder Community Health. If you are still with us here this evening, we thank you for your patience, and I'm hoping to put you on the spot to share with the board some of the strategies you've been using and the work you've been doing. Thank you, Doctor, if you might go ahead.
Sure. Thanks for that introduction. And I'll say to start off with, that was just an amazing presentation. I'm not sure how much my words are going to convince you more or less for this very important mask order, because that presentation was so excellent. And our team at BCH sincerely enjoys working with Boulder County Public Health. We're very lucky to have such an amazing team there. Just to give you a quick background about what I do, I see patients both in the hospital and in clinic, but the infectious disease doctors, including me, help provide the hospital measurements of safety. We have additional training in this, treatment protocols, testing, all of that. And I've taken care of patients with COVID-19 now for a year and a half. Of course, with a lot of other providers, hospitalists, critical care doctors, nursing, and a lot of other teams. And at the end of November 2020 is when we peaked at Boulder Community. And I hope this is our final peak number, but we're scared of that not being our final peak number. When we had one day 25 admissions at the end of November. We've seen a steady decline since that time. And actually a few days in June and July, we had nobody admitted to the hospital that had COVID-19. Today, we had 7 admissions. And in the month of August in total, we had 20 people admitted to the hospital for COVID-19. That is a doubling from the month prior, and half of those individuals were vaccinated. This has been a sudden change. Prior to that, the vaccination, people that were vaccinated made up a minority of those admitted. This is similar to what other hospitals in the Metroplex as well as nationally are seeing. Things are going in the wrong direction. We have to take action quickly. As an ID physician, we're considered problem solvers of the most complex patient cases. And I want to tell you that managing a patient with COVID-19 at the bedside day by day is incredibly humbling. and unpredictable. Our directed therapies are fair at best, and you don't know what to tell people day to day. You hope that they will be better or no worse at minimum. But as I said, this is very unpredictable. As a healthcare team, that's frustrating because you want to be able to predict what's going to happen next. But what's really mortifying is how scary it is to the person living it. In the scheme of the United States, Boulder has fared better as far as hospitalizations and deaths. The people of Boulder County played a major role in keeping BCH from being overwhelmed in the pre-vaccination era, using these non-pharmacologic interventions that prevent the spread of COVID. We are now seeing significant increases in infections, including breakthrough infections, both in the hospitalizations and in our healthcare workers from exposures in the community. This is also paralleling what's happening nationally. Unfortunately, we're at risk for the hospital becoming overwhelmed again. This is a multifactorial process and has some to do with the increasing of staffing shortages. We have a good vaccine rate in Boulder. I'll call it good, but it's not enough. We need 90% or more to really gain control over the circulation of this highly contagious virus. And waiting to get to that proportion will take too long. We need the mask mandate now. The only way to control the circulation of the Delta variant is the layered approach, which has been mentioned multiple times tonight. Vaccination makes up the biggest piece of that, but masking is critical. The infectious diseases team at BCH has been treating patients and managing hospital and community safety for 18 months and puts forth that this is absolutely, sorry, my dog, absolutely critical to move forward with this reinstitution of the mask mandate. Without this mandate, this highly infectious virus that's often spreads before you know you are sick, it spreads before you know you are sick, will not be mitigated appropriately in our community. And I think we pride ourselves in this community as giving and caring. There's nothing more essential in the moment than a mask mandate to protect us, each other, from becoming sick, hospitalized, or dying. Sorry. My husband's out, so I'm managing the puppy. Pardon that. So we're in full support. The entire hospital is in support of this mask mandate. I'm simply the person speaking on their behalf today. Thank you.
Thank you so much, Doctor, for all the work that you and your staff do. Thank you for your support. We feel about you the way you feel about us, and so thank you. President Thomas, I was going to continue. This was more of a panel sort of environment. If it pleases the board, and in consideration of time, I'd like to move on to another community partner that's been so engaged with us throughout the pandemic. Mr. O'Rourke from CU Boulder, might you join us and share some of your perspective, strategies, et cetera, with the board? Thank you.
Hi, Camille. I'm happy to be here again. And thank you to the members of the board for giving me some time. What we think we're doing at CU is an example of the multi-layered strategy. As we talked about the last time that I appeared, CU has a vaccination requirement that's applicable to its faculty, students, and staff. We've implemented that over the last several months, and we are at the point where our student, faculty, and staff have additional 10 days from now, approximately, to be able to certify their vaccination status. Currently, we've had 27,000 students report their vaccination status, and I'm happy to be able to say that 96% of them are reporting that they're vaccinated. So notwithstanding the fact that we do have exemptions that are available for religious and medical and personal reasons, they are being claimed at a less than 4% rate. Similarly, we've had 8,037 of our faculty and staff who have reported, and we are also at 96% of them. So if we continue trending in that direction, our epidemiological folks believe that we will be well over 90% of our total population and probably closer to 95% of our population. We worked with Boulder County Public Health to be able to supplement that with a masking requirement for our publicly accessible spaces that we have on campus. And before we instituted that, and we did that probably 3 weeks ago before the beginning of the fall semester, we communicated with Boulder County Public Health and met with Camille, Lexi, and Trina and other people on the staff as we went forward to be able to implement that. What we're hearing from our students is that while they would like to not be wearing masks, they would much rather be in person and being able to receive their education. And so if it was a choice between wearing a mask and not being able to continue the in-person instruction, they would much rather be here. And so we're seeing that as something that we're having success with in our community. We're seeing good results, which is that, like any other entity within the community, we are seeing some cases. But for example, today we ran 98 PCR tests and we had 3 positive diagnoses. That's a very low number in terms of both our number of cases and our ability to be able to manage them forward. So overall, we've been pleased with the way in which we've been able to start the semester. We recognize that masking order, if done in the community generally, would be an adjunct to the efforts that we're already making on campus in order to be able to preserve the environment. We have worked with Camille and with the Boulder County Public Health staff. We want to make sure that as any public order comes into effect, that we're not giving contradictory guidance on the campus. And we understand that our masking requirements, as we've stated them, are consistent with Boulder County Public Health's needs at the current time, and we'll be going through the exemption process to be able to finalize that as that comes into being. But for now, the guidance that we're going to be giving to our community is to continue with the requirements that they understand, as well as to continue to complete the vaccination protocols that we have. And we're hoping that by September 15th, which is our final deadline for reporting, that we will be above that 90% to 95% threshold. So I hope that we're able to represent that multi-layered vaccine strategy coupled with masking to be able to protect the community. We're having some good results with that, and that if it's adopted on a broader community basis, hopefully that will work to be able to make sure that Boulder remains below the state in terms of what its infectious disease curve is, and that we don't overtax the healthcare system. So I'd be happy to answer any questions that you have, but I'm pleased to be able to work with you and the Public Health Department to be able to address the current status.
Kudos to the staff and the students. Those are awesome participation rates, vaccination rates. So thanks, Patrick.
Indira, I just want to add one quick statistic to Patrick's stats that he shared, and that is that our cases that we're seeing, only less than 5% of them are coming from CU. So that's a big difference than what we saw last year, and I think a lot has to do with what CU has enacted. So thank you, Pat and team and Jennifer and the whole team. Thank you.
I appreciate that very much, and I would be remiss if I didn't mention that we have worked with Indira and others to continue with our own contact tracing case investigation so that we know what's going on in our community and aren't trying to burden what we know are already limited resources at the county level. So we're committed to being able to do that and being good partners.
Thank you, Patrick. Thank you, Dr. Gujral, for adding to those good statistics. I really appreciate it. We also mentioned, the reach out to the business community and to our city leaders. And I don't know, I'm no good at staring at the team screen, but Longmont City Manager Harold Dominguez, are you with us yet this evening? I know you probably waited a long time. Sir, hello, and you have the floor. Thank you.
Thanks. I appreciate the opportunity to talk to you all today. Before I started out, I wanted to really commend the Public Health Department and the partnership that we've had with them over the last, I guess, we're heading toward 2 years almost, but year and a half, and the work that we've been able to do with each other. I wish that we could report the numbers that CU had in terms of vaccination rates, and I want to commend them on the work that they're doing. I'm going to go off a little bit of what we're doing and kind of talk about the difference in what I've seen recently. So I have a daughter that went to college at a different university outside of Colorado. They did not put in place a vaccine mandate. They have no masking mandate. And right now, the community and the university has their hands full in terms of the number of cases and what they're dealing with. My daughter's vaccinated. Right now, I'm literally waiting on the test result to see if she has a breakthrough case. And I told them earlier, if I can't join, that's because I have to go pick her up. Because they're also not providing a quarantine dorm or anything like that. I'm on a message board for the parents group, and I heard a story last night of where one of their children actually was in the emergency room who had COVID, tested positive, also had strep on top of it, and the emergency room wait was somewhere in the neighborhood of 13 hours. And as I'm watching their hospital capacities there, one of the most significant, or a major hospital, upwards of 95% of capacity on hospital beds, and I think their ICU capacity, the last time I checked, it was 97. And you're probably going, why are you checking this? And I'm checking it because it could be as simple as my daughter has an appendicitis attack or is in a car wreck, and what's the likelihood of her receiving the medical treatment she would if you have a system that is overtaxed. And I say that because I think it provides reference in terms of what's happening in other areas of the country. What we've done, and when we looked at this a few weeks ago, I think we as an organization were at approximately 70% of our staff was vaccinated. One of the things that we were really looking at was how do we encourage vaccination? And we talked about everything from encouragement to mandate. Also understanding the impact of mandate and what that may mean to some of our staff members. And so we actually took the approach of incentivizing it. So what we did was we offered 8 hours of vacation for our staff to get vaccinated, but we also said that if you're not vaccinated, this was before any masking mandates, we were going to require you to wear a mask if you're unvaccinated or you fail to report. And we are holding our staff accountable on that. I just got a report today, so we were at about 70.7%. The report today is at 76.7%, so we saw a 6% swing based on the incentive. We did time limit the incentive, and what I'm now starting to hear, and this is really a product of the Pfizer vaccine being approved with the FDA. I actually had a couple of folks reach out to me and say, now that it's approved, can I still do this? And so we're getting ready and contemplating the next step in this to say, and as you all contemplate the masking order, if you move forward, our next step is going to be probably to reinstitute the incentive one more time for folks that get vaccinated, but also potentially add the requirement that they have to be tested on a regular basis so that we can ensure that, they're not COVID positive. And that's sort of the next step that we're looking at taking. And so we will probably be making that decision next week, hopefully trying to achieve the results that CU has put in place. The one thing I wanted to talk about also with you all from a business perspective, and I can't say that this is all inclusive for every business in Longmont, I've had conversations with our Downtown Development Association, our Economic Development Association, and members of our Chamber of Commerce. And I think the one thing that the business community has said, and it really resonates with all of us, is no one wants to go back to the point where we're retracting to where we have significant closures and they can't operate as they need to. And again, I'm going to say this one more time. This is not all inclusive of every business. This is generally what I'm hearing. No, but no one wants to go to that point because they don't think they can survive if they reach that point. And they have said, we would rather have a mask mandate. And frankly, they said it would also make it easier for them if it was uniform in this to enforce. And if that prevents us from moving back into that area where they have reduced occupancy numbers or even closures, that's where they want to be so that they can continue operating and protecting their livelihood. I think it's a great idea in terms of giving the businesses the option to say, hey, can we get this exemption if we can ensure that, you know, we have everyone that's in our establishment vaccinated, and it gives folks that opportunity. I'm not sure where they'll all set, but some may take it. But I think giving flexibility and options for them to look at make different choices, but not go back to where they're reducing capacity is what I've heard is really important to them. Be happy to answer any other questions. I could probably say a lot more, but here to answer questions if you have any. If not, just thank you. And I know this is a tough decision, and I really appreciate the working relationship that we've had.
City Manager, Boulder County Public Health shares those sentiments, and thank you so much for sharing your strategies and even your personal stories. I think it's a powerful testament to our ongoing collaboration. I want to step in ahead of one more speaker, who is our County Administrator, Jana Peterson, if she is still on. I want you to know that Assistant City Manager for the City of Boulder, Pam Davis, really wanted to join us this evening. She had an obligation that took her away from the meeting, but I'm going to read a couple of the things that she intended to share, and I'm honored that she trusts me to go ahead and read her comments. They are eager to support the Boulder County Public Health strategic strategy and vision regarding enhanced goal-oriented approaches regarding this proposed order. I'm reading practically directly from her statement. She was asked by us to share a little bit about what Boulder is doing. And, you know, the city of Boulder has articulated that the desired outcome that all Boulder community members have the potential to experience successful personal and community level COVID-19 recovery, regardless of race, ethnicity, and other personal identities, health, or socioeconomic circumstances is their focus. And this does include containing community spread and increasing vaccination. And to that end, here's what the City of Boulder has been doing. Ongoing support of the testing site at Stasio Ballfields, a city parks and recreation facility. In addition, their utilities department is conducting wastewater monitoring for the virus, and they are sharing that data with public health. They are conducting Sunday vaccine clinics at Boulder Public Library main branch with a focus on reaching community members who are unsheltered, who are people of color or downtown workers. They are sharing the responsibility for ongoing public information and engagement. They are consulting with the business community to ease their struggles while maintaining health and safety at the heart of the economic strategy of the city. They are taking steps to protect their own workforce and city operations through internal masking and vaccination policies, workforce exposure tracking, and modifying their services and programs to continue meeting community needs while minimizing risk. The city remains committed to these activities and others that will help manifest equity throughout the COVID response and recovery process so that the needs of all community members are met and that all community members have the ability and potential to successfully and holistically recover from the pandemic. And Assistant City Manager Davis says, I wish you the best in your final decision making and thank you for the opportunity to share this information tonight. I thank Assistant City Manager Davis for the pleasure of being able to read her statement. County Administrator Peterson, are you still in the room to join us and share your contribution to the Board of Health this evening? It could be that other obligations took our county administrator away. In all, I know that there is one more person that was not on my list per se, but if the mayor of Nederland is still in the room, I know you were waiting to speak as well. And it's so great that you are here. Mayor Larson, are you with us? And would you like to take this opportunity, just one last speaker, Board of Health, for this panel portion before you make your decision? Mayor, are you available? It looks like the mayor is trying. Hello, Mayor. This is Camille. Hello.
Oh, I'm going closer to the router. Go closer to the router. Well, maybe get a better signal. Thank you. Thank you for. Can you hear me?
We can hear you fine.
Yes. Yes. Go right ahead.
Okay. I'm going to turn off my video. So again, thank you for hearing from me this evening. My name is Chris Larson. I'm the mayor up here in Nederland, and I just really want to speak in favor of the indoor masking order. I've been speaking to some of our businesses here in town, and some of them have tried to institute a masking order for their individual businesses and face significant pushback from visitors, mainly out-of-state visitors. So being able to say that it is not a business's choice, it is a county requirement, really helps us protect our residents, our businesses, and their employees here in Nederland. And I am amazed to hear the CU statistics, particularly since I'm also a CU employee. I'm one of those 96% that are vaccinated at CU, and I think that is incredible news. But what is sad news is that right now Nederland has one of the lowest vaccination rates in the county. The last time I saw the number, we are still below 50%. So a masking order is critical to trying to protect the residents of my community. And I really appreciate the fact that you guys are looking at doing this. And I really like the multi-level approach and the flexibility built into this one so that as we do get back on top of this current wave, then it can automatically go back. The masking order doesn't have to be repealed. It'll take care of itself. So again, thank you very much for doing this. And I really, really appreciate you guys having our backs here at the small town level by instituting a mask order.
Thank you, Mayor. Thank you to all of those that joined us this evening. Board of Health, there were other community leaders that emailed me their support. I could go on, but I think you get the sentiment that businesses are willing to mask, to stay open. One community leader who works primarily with Latinx businesses said, yes, let's protect even those, especially that still cannot be vaccinated, by all of us wearing our masks. So thank you for all of this extra time and for your attentiveness. President Thomas, I turn it back over to you, sir.
Thank you, Camille. Thanks to all of the representatives from local jurisdictions and CU for sharing your thoughts and your conversations with your communities. I do think that is certainly helpful. So thanks for taking that time. Just a time check. We are 2 hours into this meeting. Remember earlier, if you are a member of the public, you were required to, if you were going to provide public comment, you were required to do that through the sign-up link in advance of the meeting. So Mayor Larson just spoke, and so we had 7 registered comments. A couple of those were written, so now we have 6. The folks did indicate who provided written comment. They did indicate they might wish to speak. So I am going to read through that in the order of the requests that we received. If you do not want to speak, I can just read that comment. I'm not sure if that's really necessary, Kate, but I'm happy to do that. And then we just need a timer. And I know, Kate, you did such a fantastic job last time, but we also have Rita on the call. So who is going to monitor time?
So I will add that, Greg, I'll defer to you as to whether or not you would like to read those written comments. It's completely within your discretion. And I believe Rita will be timekeeping.
Okay, good to know. Okay, so the first comment we had was a written comment, may wish to speak. Gregory Shader, are you on, Gregory? Okay, if he chimes in, I will let him kind of pick up, but just in general, I will paraphrase his comment. He wished to object to a new indoor mask mandate. He has supported past measures, but today everybody over 12 who wants to be vaccinated can and should be. And unless BCPH can produce data showing vaccinated residents to be hospitalized or dying at a high rate, this measure is inappropriate. I think the department has demonstrated that cases of hospitalizations and certainly breakthrough cases are occurring in the vaccinated population. Granted, it's not extremely high risk, but that's what was expected. Individuals who refuse to vaccinate are at risk, and they take risk they take selfishly. We should not need to change our behavior to save anti-vaxxers. That's basically the gist of his message. Jeanette Taylor was next, and she did not provide written comment, but she indicated she wished to speak. Jeanette Taylor, are you out there?
I am, thank you. Can you hear me all right?
We can hear you fine.
Great, thank you. I am also from Netherlands. I'm glad to have seen our mayor speak on behalf of local businesses. I just wanted, I'll be very brief. I just want to tell you that I'm 63, my husband's 64. We are both vaccinated, and we just lost 2.5 weeks of our lives to COVID because we had breakthrough infections. I was unable to work during that time, so I had loss of income. My husband was able to work, although he probably shouldn't have because he works from home. So breakthrough infections are real, and loss of income as a result of them is real. We had that ridiculous idea that we didn't have to mask because we were vaccinated. Well, that's just not reality. Totally in support of a mask mandate. I work in the library. I deal with the public all the time. One other thing I want to point out, and I just want to further support what Mayor Larson said, a 19-year-old who's working in a gift shop and whose boss has told her to enforce masks and has a bunch of tourists coming in from other states is totally at the mercy of those people. And if you can give them the support they need to say, I'm sorry, but it is a community decision. It is from our county. You have to wear a mask. It would really be helpful to those young people and to those restaurant workers and retail workers. So that's all I wanted to say. Thank you for serving on the Board of Health, and thank you for considering this mandate.
Okay, thank you, Jeanette. Mayor Larson was third, but he already went. So we will move down to Dr. Kevin Dryden, and he did not provide written comment, but he does wish to speak. Now, let me check the list here. Does look like he is on. Dr. Dryden.
Thank you. Yes, I am on. I appreciate you allowing me to speak. Sorry, I was muted and had to get to a place where I could talk. Thank you. I am speaking in support of the mask mandate. I am a family physician in town. I'm also assistant medical director at the People's Clinic, our local community health center. And I've been a physician there for 16 years. I also take call at a Vista hospital. I've been treating COVID patients since the beginning. I'm also a dad. I have 2 school-age kids. So I don't think I can elaborate more upon the brilliant presentation earlier that had a lot better data than I was able to pull together. But it's a simple thing, I think, that will really get our community where we need to be, decrease the transmission, and as the business partners have pointed out, keep businesses open rather than the big closures. You know, we have this large group of ineligible unvaccinated folks under age 12. I have one of those in my house, and you know, they've suffered this last year. School online was unsatisfactory. The amount of emotional distress that's caused these kids has been immense. Children's Hospital declared actually a state of emergency for childhood mental health because of this. If we can do our best to keep these kids in school in person, not only will it help their education, but their social and emotional development and well-being will improve. So thank you. That's all the time I'll have.
Okay, thank you, Dr. Dryden. Next up, we have David Weingarten.
Hi there. Hopefully you can hear me.
Yes.
Okay, great. Thanks for having me. I'm David Weingarten. I'm with Z2 Entertainment, and we run the Boulder Theater, the Fox, and several other venues. And we book Chautauqua and a bunch of other venues around town. And we've been on very early on. We were making sure that we were keeping our patrons safe and doing things that we needed to do to make sure that not only our patrons, staff, and artists were safe, and are safe, but also making sure that the community is safe as well. And you know, as the 3rd largest driver in the state of Colorado, the entertainment business, we have sort of been kicked to the curb as an industry, and we were the first to be shut down and the last to reopen. And we are having a mask mandate is something that we would that we totally understand. But I also would ask that you know, we've been on the forefront of the vaccine protocol for a long time so far, and we, you know, about a month or 2 ago, we actually instituted a vax policy, a proof of vaccination or 72 hours of a negative test. And you know, we definitely got some hate mail, but like for the most part, we have it's been wonderful. And we're actually changing our policy on October 1st, so all patrons will be vax only to come into the place. All of our staff are fully vaxxed. We don't schedule any bartenders or security or anybody like that unless they are vaxxed. So we've been on the forefront of all of this, and this mask policy in its current way is going to be very detrimental for us, and especially if it's going to be going into effect tomorrow when we have shows throughout this. You know, we're not like a hardware store where we can just turn on and off the, you know, the open sign. These are like big major tours that come in. I've got a major underplay, like that giant artist who's coming in on September 14th that really want to come in, that you know, this would probably hinder. I've got a sold out show on September 7th. You know, so if there's any sort of ability to make sure that those if we can make those exceptions start now for businesses that have already been following this, it's very easy for us to start on tomorrow. If you want us to do it on starting tomorrow, it's a vax only for everybody. We can do it, but to say that we have to wait 30 days to apply is going to shut us down. We're going to have to. We've been down for 15 months already. We had $0 for 15 months. We really could use some help, and we were not notified on any of this stuff as far as like getting feedback from organizations. This is going to kill bars.
Your time is up. Thank you.
Thank you.
Thank you, David. Okay, next up we have Cheryl Liguri. Cheryl, are you there?
Hi. I'm Cheryl. I'm the
CEO of Z2 Entertainment, to just follow up on what David has said. We've been on the forefront. You know, we are as a business in support of the mask mandate, with one exception that was brought to light in the Boulder County call this afternoon. We are primarily a standing venue, and we're told that we would not be able to allow patrons to drop their mask to drink their beverage and put their mask back up, that was not acceptable. As David said, we are going to a vax-only policy. We are ready to do that tomorrow if need be. We need one exception to be able to serve our patrons and not shutter our business, to allow people to drop their mask while they're having a drink. Because if we have to have our patrons sit at a table in order to do that, we are in essence capacity restricted, and we will need to shutter our business and lay off our 150 employees till, for the, could be for a very long time. So I would respectfully request that for these standing concerts that we be allowed to tell our masked and vaccinated patrons that they can actually be served a drink and can drop their mask to sip on their beverage. So that's the only way that we will be able to remain in business. So I'm happy to answer any questions about that, but David's correct. We're not a business that can just open the next day. These are contracts for a specified capacity with tickets sold that are booked months and months in advance, and we will be shuttered for a very long time if we are not allowed some kind of accommodation for standing beverage consumption. Thank you so much, and we appreciate all you're doing.
Thank you, Cheryl. And then we actually have two more. We had one that came in to me late. Susan Marr. She provided written comment, but Susan, if you're out there, would you like to speak? I don't see a Susan Marr on the list. So Susan said, I live in Broomfield, but work in Boulder. So your goal of masking the populace does not impact me. I am disturbed by your insistence on irrationally subjecting people to mandates and orders that are completely useless, often harmful, and have no basis in science. There is zero evidence that masking made any difference. On the contrary, there's ample evidence for the negative impacts to health and social interactions as a result. Provided a reference, but anyway. That is, and then we had the last one that came in was Laura Graber. Laura had written comment. I'm not sure if she's on the call either. Let me take a look. Does not look like Laura Graber's on the call either. She says that I believe this will further divide the community. Some people have valid reasons to not get vaccinated, and a vaccine passport is discriminatory against a minority group. Let's look at how we can help our community get and stay really healthy in an inclusive way. I'd like to see stats. I'd like to see them. Yeah, we've done that. Additionally, we need to be scientific. Natural immunity needs to be strongly considered. And we need to be sure looking at studies that, so it's about masks and personal health. So that's it. Okay, so that concludes the public comment portion of this hearing. And I believe the next step, Trina and Camille, is deliberation by the board.
Yes, unless the board has any questions that you'd like staff to follow up on.
So, Go ahead, Morgan. If you guys want to raise your hand, that's fine. We'll get to you all. Don't worry.
All right, I'll raise my hand because I am compelled by the input of our local music venues and wanted some clarification also around that. So is their interpretation is that like bars and music venues that right now, as it's written, people will not be able to lower their mask to drink a beer or whatever they're drinking.
So the language of the order is the same language that was in effect in the spring, which was seated at a food service establishment. If this board is concerned about that, we could follow the way San Francisco has their order drafted, which is actively eating or drinking. That is another option.
I think that's a reasonable option for the month of September.
I do too. I think that's really important, and I take those comments very seriously.
Yes, and I want to commend our local music venues for taking such a strong stance and leadership in support of vaccinations. So thank you for your role in doing that.
So Trina, quick question, is 30 days long enough for the exemption? Because if it's going to take, so 30 days to have the, it's okay if you're eating or drinking to have your mask down regardless of being seated, is 30 days long enough to institute the new vaccine exemption policy? So would they be able to apply for and be approved? Because I know you said it would take 28 days to work it out. Is that going to be long enough for them to be able to prove that they're only admitting vaccinated people and get the exemption?
So there's kind of two issues going on here. I would caution the board not to craft an order around one single venue, but rather to think of the order holistically. So there's the issue of the eating exemption. As it's written, it's seated at a food service establishment. I think it might be a little confusing to change the language 30 days out from now. The second issue is when can venues that are already having mandatory mask orders in place start applying. And if the board would like to direct public health to look at venues that already have those policies in place immediately, I would defer to Lane as to the feasibility there, but I think that could be a request from a board, just being mindful we don't want a flood of applications.
And I apologize if I threw out a number of days and I probably confused you, Brooke. I think the way it works in San Francisco, Trina, it sounds like is that would be written into the order and it would be effective until it was amended.
Correct. So we could write into the order that if you are seated at a food service establishment or you are actively eating or drinking, then you may pull down your mask. Or we could choose just the actively eating or drinking language. My understanding is that San Francisco has applied that to mean I go and sit in a restaurant, I need to keep my mask on until my food actually comes. So that would be the difference there. But we could use either language at this board's pleasure, or both languages. We could use both.
Yeah, I think the seated plus, or, so seated or actively eating or drinking.
I agree. I think that covers all bases for me comfortably.
Can Lane weigh in on just the feasibility of if we go with applications right away for groups that are already in a place where they've got a vaccination policy in place?
Yeah, I mean, I think we're gonna need to have some level of criteria. So we've already put a little forethought. Trina's done a lot of work, as have our EPI folks, on concerns that they have about a policy like this in general. So we can certainly look at things. I think we know we have folks that have active programs that pre-exist this public health order and this potential program. We would definitely work our best to figure out, but I don't know the volume of what kind of requests we will get. So it's hard to commit to, yes, we can turn this on tomorrow or at 5 p.m. when the order potentially goes into effect. So, but we would certainly work as quickly as we can.
So the actively eating and drinking, based on what David and Cheryl said, they said they could institute the vax policy tomorrow, which would be an informal. We're not going to be able to approve anything in that time, but that gives me comfort in that if they're standing and drinking and pulling down their mask, if they're vaxxed, then I think that gives me additional comfort. I guess the question comes into, for all the other non-music venues, bars, what does that mean, right? If those bars don't have a vax policy to get in, then it really becomes difficult to enforce.
I guess I wasn't thinking that we were, I think we'd still have the application process. I guess I'm comfortable applying this actively eating and drinking to any venue, right? Whether or not you've got the vaccination program in place yet, and that we hope that more will adopt it. But that's what I was thinking.
Lindy, you're good with that too?
Yeah, that's exactly what I was thinking as well.
Landry and Brooke?
Yeah, I agree.
Yeah, agreed.
Okay, well, I think that makes 5 of us. So what will that take, Trina? Well, I mean, we can take an action tonight that doesn't require those exact changes to be made right now, right?
So the request from the board, and I see Dr. Urbina has his hand up, the request from the board is as written on the agenda, but I have heard the board's preference with respect to how the eating and drinking is addressed. So I will make that change in the draft order, and it can be issued as the board requested, as seated in a food establishment or actively eating and drinking.
Dr. Urbina?
Yeah, I just wanted to make sure that we're clear about the purpose of the layered approaches here. I'm concerned, frankly, about people that have had a little bit too much to drink, that are going to forget that they're taking down their mask off and on, and that mask is going to be quickly off the entire time, and it really defeats the purpose of the order. So I think we have to be clear that as we move to having this fully vaccinated policy, we don't gut the intent of the layered approaches as we move forward in this language.
And I totally hear that. I also think that if you are, in a bar, you're accepting a certain level of risk anyway, with people. I mean, you are going to be spending some time eating and drinking. That's sort of the choice that was made there. But I totally hear what you're saying.
And
I can't.
Go ahead, Brooke.
I was just going to say, at this point, I would not be comfortable shuttering whole sectors of businesses.
Yeah, and I hear you, Dr. Urbina, and I agree. And if this was last September, when there was no vaccine, I would be, that would be an extremely difficult decision to make. We saw let's say the 20s to 40s are going to be the prime population of these venues. Well, unfortunately, they are the lowest vaccinated, whatever, 55 to 65%. So it's a conundrum for sure. But I think I still feel the way the other board members feel, because the effective date is tomorrow. I mean, that is really sudden. And I don't have, I'm optimistic that venues will take precautions. I know I can't guarantee that. Enforcement is so difficult, right? The mask up, mask down, drinking, not drinking. I don't know. I mean, it's a tough one.
There's a lot of staff with hands up.
Brooke?
I was going to let everybody else finish their thoughts on this first.
Okay, so that was one change. Camille and Lexi and Trina, Looks like you are up next. And David, I see you have your hand up, but the public comment period is over, so we won't be able to engage in a Q&A with you. Okay.
Thank you, President Thomas. And if it pleases the board, I wonder if I might put forth an idea, especially relative to some of the amazing venues that came into the public comment arena and expressed how they are right in line with our strategy here. And I think this, it just coincides with our relationship with CU Boulder, for example. It's too bad, that I didn't know already that such amazing venues had those great policies. What if, as a solution to the time frame of approving those applications of those folks that want to become a voluntary, fully vaccinated facility, what if we consider allowing a self-certification for those who have established vaccination policies for 30 to 45 days here, so that they can continue with their good business, and then we will have time to review their application, because I suppose that just like those amazing businesses that came to this public comment, there could be many others that have excellent vendor or employee and customer vaccination policies in place. It isn't fully cooked. It was an idea I will not take credit for, but I'm bringing it forward for your consideration as a possibility in this, for your consideration. Thank you.
Trina?
Yeah, just to round out what Director Rodriguez proposed, to address this issue of businesses that are already right in step with us, we could do a self-certification and allow them 30 days or 45 days to submit the full application when everything will be stood up, which will bridge the gap in a way that will not interrupt business operations, but will still achieve the same results.
Yeah, and then I'm so sorry, Member Hinman. And then I want to add that obviously we would still be doing our enforcement. And so, should we receive a complaint, it would still be part of our education and check-ins and enforcement to those venues if the application is pending for those 45 days or 30 days. Thank you. I'm so sorry, Member Hinman.
No, that's fine. Director Rodriguez, I like this idea because I think it goes very part and parcel with what we're presenting today, which is this partnership concept, that this is the community writ large working together to solve this problem. And if there are organizations already that are working to solve this problem actively, I think we should take that into consideration very seriously in this discussion.
Could you clarify? So this would be in addition to modifying the language in the order? Okay,
so we would
just wanted to make sure.
Yes.
Okay.
Yeah, we would modify the food establishment and then also add this self-certification, temporary self-certification provision. We would do both.
Yeah, I agree with what Lindy said.
And so let me so in a case of a bar in downtown Boulder who's not aware of this upcoming change, how would that work for them? Like, it's mostly a standing place, right? So the mask up, mask down, drinking, do they have to wait for that guidance for that program to be rolled out? Or are you saying that they can kind of just say, well, we're going to just make everybody prove vaccination and we'll self-certify that way?
I'll jump in and say, President Thomas, that I think our staff would have to regroup rather quickly and have some kind of form to be alerted to their self-certification with maybe some minimal check mark boxes that then we would follow up with as part of the formal application process. And their assertions on that checklist would have to coincide with what we verify as the compliance towards this program as we progress through the formal application process. I think that it really would build a trust with businesses. I think it would inspire businesses who don't have policies in place or fully developed policies to get those going. But I do think we are going to have some kind of, we're going to need to have some kind of simple criteria to log which businesses are self-certifying clearly. So there is going to be some adjustment here on our part, but we are certainly willing to support, especially those places that clearly have already some robust policies in place.
Okay. Lexi, you had your hand up earlier. Did you take it down?
I did, thank you.
Okay. Any other questions? Camille, you still have your hand up? Are you? Okay, so board members, please resume. Brooke.
Okay, so I like what I am hearing as, so my issue really with the mask mandates is if there's a lack of incentive for vaccination. So for those of us who have been vaccinated, we're going to then protect those who are opting not to. And then I did look at some of the counties that have implemented a new mask mandate more than 4 weeks ago. So they've got 4 weeks after the mask mandate, and their case rates appear to be still going up. And so my question is if we institute the mask mandate and people don't seem to start to buy into this 100% vaccinated establishment to get the exemptions and encourage vaccination, what is our next step, and do we have a cutoff for it? So are we looking at more shutdowns and more reduced capacity, or are we looking at moving towards more more vaccination mandates and a vaccine passport system?
And Brooke, I appreciate the question. I'm going to add just another context there is that, as a reminder, we still have a great deal of people who are ineligible for vaccines too. So, thinking about my own kids, and I try not to take them indoors right now, but sometimes I have to take them indoors, and and there is that factor too, is that can we help protect those that are ineligible for vaccines at this point?
Yeah, and I understand that, but if we look at our case rates, we're looking at 23 to 44-year-olds who are all eligible for vaccination.
Morgan.
I think yes, and we have increasing pediatric cases, and and again, I think that I hear what you're saying. We don't want to disincentivize people to get vaccinated, but I think there's still a role to play in protecting as much as we can indoor spaces for those who are ineligible for vaccines. So that's kind of my perspective on who are we trying to protect, and in addition, those of us who are vaccinated who are also concerned about breakthrough cases. So
I'm more curious what our next step is. So should we institute a mask mandate? Cases continue to go up. We don't see an increase in vaccination because despite the voluntary vaccine exemption for businesses, what is the next step? Like, are we looking at more shutdowns? I mean, because I'm assuming we have a plan, especially since we've been through this once before. Are we looking at shutdowns, or are we looking at more reactionary, more forced vaccination, like a vaccine passport?
I will start the conversation to answer your questions and concerns by sort of leaning back towards the presentation that staff gave. We actually didn't see vaccine passports as a negative consequence or anything that would be a punishment of sorts for this community. It is something that we looked at as a positivity, as one of those trends towards the change in our perspective and behaviors toward the long-term strategy. So with that said, our goal is to plan for, operationally, we are working towards planning to set up family-centered clinics when we do find that we can vaccinate the 5 to 11-year-old range, for example. We're working to that end, getting ready for those moments. So there's so many strategies that are going on that we didn't even mention in our presentation, let alone to continue to promote vaccine equity, to dispel myths about vaccinations in general to those who are really sort of resisting the thought of getting vaccinated, those key age groups. But in all, closures are what we want to prevent. And so we're remaining in our focus on a trajectory. I don't have a plan to come to you to recommend closing down businesses, because my plan is to continue to pound the pavement and to work hard to encourage vaccine policies, not mandates, but policies, so that our community can really enjoy their venues. They can go to the library, they can go to the grocery store and be healthy. But I also hope that I see Dr. Urbina, oh no, I didn't see Dr. Urbina, come on, I apologize. But if any of the other epidemiological staff would like to jump in here, I feel like I'm such a positive person in general, membership, that I don't have a consequence that includes the Armageddon. I really believe in this community that we're going to move towards vaccination completion. My goal is 100%. I think you've heard me say it before, and I really believe in that.
And Dr. Urbina?
Yes, you did see me pop my face on here, Director Rodriguez. I think if we go back to Indira and Lexi's presentation, Board Member Harrison, it really is a layered approach. It's not we do this all in stepwise fashion. At this point, we have a very high vaccination rate, which is really our number one protection and prevention of COVID-19. In the interim, we've instituted a public health order for schools, K through 12 ECE, and we're proposing this public health order for indoor masking. And we're still continuing to implement all the layers that Lexi talked about. So it's a comprehensive strategy that we're trying, as Director Rodriguez said, we're trying to avoid those red mandates by preventing. What we do best in public health is to implement them all at one time. And the key piece of this is monitoring the data. Some of the data that you cited earlier are really downstream things. We're not going to see changes immediately. We're going to see these changes over time. So it's probably a 4 to 6 week lag in terms of all these mitigation in place. And if it's going to be 4 to 6 weeks before we get everybody vaccinated, so it's going to be maybe through the winter months to have all those strategies in place. So we're right at that transition period with all these public health orders and layers put into place. So I think you will see, and we'll be monitoring that data very closely to see and present back to the board how we're doing and come up with strategies as we move along. I hope that helps.
Landry.
I was going to say something very similar. I really do, Brooke, see it as a both and approach. It's not like we should support vaccines and not indoor masking. I mean, breakthrough cases that are mild and vaccinated, people will get spread to the unvaccinated pretty easily. So I think it's definitely a both and it's easy. You can't have all the answers moving forward as to what the next steps would be. But I agree that I don't think it makes sense to do one and not the other. It's just
No, and I agree. I'm not saying one or the other, and I understand the layered approach. I'm just asking that if this doesn't work, do we have a plan for what the next step is?
Well,
And I understand if the answer is not really, because we have to see what happens.
Yeah, I mean, like social distancing, right? We're talking about mask, but not any of the distancing, capacity reduction requirements that, in your scenario of cases continue to go up, well, that would be a logical next step, right? And then beyond that, we'll learn things as we go, but clearly that would seem like the logical next step beyond a mask order. Indira.
Yeah, I just want to add one point, and that is around our healthcare systems. So I think in Michael's presentation, he showed what's happening regionally, and even locally, you heard from a local physician. And prior to having vaccinations, our eye was always on the healthcare systems and the health of the healthcare system, including staffing to be able to care for people in the community. And now that we have vaccines, we're looking a lot at not just the healthcare systems, but the community transmission. And I do think, I hear what you're saying, Brooke, but I also feel like if we don't add in the mask mandates, that we could be in serious problems. We could have some serious problems. And the way that the Delta virus transmission occurs, it's so rapid and so fast, it could happen really quickly. So I just wanted to add those key points in.
Yeah, and just to be clear, I'm not saying not do the mask mandate. I am just asking, if vaccines are the means to not closing down again, will we consider more vaccine mandates, a county-wide vaccine passport program, something like that?
I think that what Lexi also presented to, which I think is really important, is that it can't just be public health that's issuing these orders. It has to be the community buy-in to preventing the transmission. And our overarching goal is to keep our businesses open, keep our schools open, and keeping our classrooms and higher education open. And so I do think that you bring up a good point. We are definitely going to be monitoring the data, and we're going to be working with the community to help the community help support our strategies moving forward. And I think what Lane and Kelly have done is built a tremendous opportunity for us to start pivoting in that direction.
Okay, so it is 7:45. We seem to be in agreement as a board that with that provision of in the act of eating or drinking, which would address some of the concerns, certainly that we heard from the music venues, but probably also non-restaurant type places. Are we in agreement? So, because if we are, then I would say that Trina can, include that in the order, and then we can proceed to closing arguments for the board members.
And then what about the self-certification program, Greg? Where does that come in? It's not part of the order, it's a different.
Camille, you brought that one up, so would that be part of the order?
Yes,
Okay.
sir.
Okay. Trina, you just wanted to say yes?
Yes, I just wanted to make sure I had clear direction on how to write it.
Okay. All right. So I think it's a good time for closing arguments. You don't have to provide any, certainly, but I'll just say that I do support the mask. I think it is a reasonable next step. I think it's a very creative idea to come up with the incentive for businesses of all types to really come up with a vaccination program for their workers, their customers, whatever it might look like. And I think that, 1 month lead time to develop that guidance, the full guidance is really a smart step. I like, for now, I like the additional flexibility for the eating or drinking, especially since this is going to take effect tomorrow. And then I would just say that the school of public health projections, we see the past data and we hear about modeling, but when you look at the end of July report that they put out, they predicted that things would really kind of peak from a hospitalization standpoint anyway in early to mid-October. I have not seen the updated modeling, but it sounds like others have access to that and it's not looking good. All I know is that in their August 19th, Dr. Samet's August 19th email to various folks within School of Public Health, he said the epidemic curve has unexpectedly and unfortunately ascended rapidly over the last several weeks. So our transmission control, which probably largely is related to not masking, but also not distancing, and the fact that Delta is so transmissible, and 50 to 70, 80% vaccination is great in the context of where we were in December of last year, but it's, as we heard, it's not enough. And so we're at this very delicate point of we need to probably take this action to try and at least flatten the curve, right? We might not squash it right away, but we've got to take some additional action. And we are starting to go into flu season probably toward the end of next month. And we know masks work because flu season was pretty much non-existent last year. And people will be getting their shots here probably in the next 1 to 2 months. And so I think this is a very prudent move. We've been through masking for pretty much 15 months. The sun still rose, the earth still spun. So I know it's not anything that vaxxed or unvaxxed people typically love to do, but it is, I'm wearing masks more now in public places. And so that's why I'm voting yes tonight. Thank you.
Yeah, I support this move too. I think it's much better than some of the other options for trying to cut back on transmission. And we are trying this layered approach that is evidence-based. I just want to say that again, it is evidence-based. So that's what's driving this and many of the other measures that we're trying to implement. And I hear the desire for some consistency. I'd also love to, I think it's great, this program to encourage businesses to look at how they can enhance their own safety. And I also understand that's not going to be a fit for all businesses. So just encouraging Lane and Kelly and your team to think about how we support businesses and provide resources, whatever the hurdles are to implementing programs. Also, I don't know if there's a cost involved in some of the software stuff. I know it's a burden to try to check everyone who's coming and going out of your establishment. So, whatever we can continue to do to support businesses so that we can make this easier on them to implement those programs is great. I know I am a broken record on that. I have unvaccinated children at home, but I just want to emphasize again that we are on the board. We are volunteers and we are parents and we, are members of this community who really care. So I just want to be sure that folks who are listening into this are hearing that. We are trying not to overburden members of the community. We're just trying to really keep as many folks as we can safe, including those who don't have the opportunity to be vaccinated. So there's my closing arguments, as you say, Greg. Thanks.
I agree that a mask mandate is the easiest and simplest thing to implement to try to stem the spread of COVID-19, especially with the Delta variant out there. And I also like that we've instituted the potential vaccine vaccinated only exemption for businesses that does provide some incentive for individuals to get vaccinated and for businesses to institute a vaccine requirement. However, I'm still skeptical. I'm skeptical that the unvaccinated will wear their masks. And I am a little skeptical that it will stem the spread quickly, especially if our surrounding counties don't implement one as well. And so my only urging is beyond the layered approach to have some set cut points that you can share with us that at this case rate, we're going to do X, Y, and Z type of thing. Thanks.
And I'll hop in. First of all, this is my first board meeting and it's been a journey. I just want to say I've been completely impressed by this entire presentation. Director Rodriguez, I want to commend you and the staff for what you put forward here tonight. It was extraordinarily thoughtful, in my opinion, very data driven, and really helped me get a grip on what the situation is and what the right decision is as a result. So thank you for that. The board, you've been so thoughtful. And everyone that's participated, it's just been entirely impressive to me, and it makes me proud to be a part of this community. I think where we've landed is appropriate. I think we are taking a balanced approach, which I think at this stage of the game is really important for all the reasons that have been articulated for our businesses, for our community. And I really do believe that we are taking an evidence-based approach. I like the layered approach that's not a one-size-fits-all, and we need to try different things to make this work successfully. And I very much like the partnership mentality. I think that's what's going to get us to ultimate success in our community, and getting more people on board, right, with what we need to do to really quell this this virus. And so thank you for the opportunity. I've enjoyed literally every minute of it, and I'm honored to support this policy.
Landry, do you have anything you want to add? Okay. You can always do that, and I do think to wrap this up, I do think that, when we talk about vaccine and how are we going to continue to move the needle, I think, some businesses might, at least in Boulder County, might really kind of use that opt-out or exception to kind of further reinforce that message. I think the other thing too is that while we are doing these moves to protect public health, the other thing to consider is that Pfizer vaccine is approved by FDA. It's not an emergency use authorization anymore. And, I am worried that folks are going to, the financial impacts of getting infected and going to the hospital, a lot of that stuff has been, I guess, free or covered under the insurance up till now. But I think that now you have this choice. You either get vaccinated or you don't. And whether that's health insurance premiums go up for unvaccinated, or whether it's medical expenses that will actually be real, that's going to probably have to move the needle too. And so it's clearly we need to get the transmission under control and the virus under control. So anyway, I'll just leave it there. Kate.
Thanks, Greg. I apologize for interjecting in the middle of the closing statements. I will just add, if it's possible, as part of the motion to approve language for the director to modify or amend the order as needed. Sometimes as these things roll out, the public brings to our attention nuances that we may have missed. So with the full intent of, sticking with this board's intent, just that additional authorization.
Okay. All right. Well, that concludes our testimony. And so can I have somebody make a motion? And don't worry about getting it exactly right the first time. If we need to correct it, we will.
Who has the public health order number in front of them? I'm like, what's the, it's 2021-08? Is that what the?
Yes.
Yes, ma'am.
Okay, I will move to approve Public Health Order 2021-08 with the changes that we've talked about this evening, so the updates that we've talked about this evening, and so that the director can modify the order as needed going forward. Does that capture?
This is Landry, a second.
Motion and a second. Trina, anything, does that work?
I saw Kate's hand go up. Uh-oh, what'd I get wrong, Kate?
I apologize, you didn't get anything wrong. One additional request, just language-wise, if you could specifically authorize Director Rodriguez to issue the order. Sorry.
No, this is what I need. Okay, so moving for Public Health Order 2021-08 to be approved, and that we authorize Director Rodriguez to be able to modify the order going forward as needed.
A second again.
Okay, we have a motion and a second. Any additional clarification? Nope. Okay, well, we have a motion and a second, so all in favor? Aye.
Aye.
Okay, that motion is unanimous. Thank you to all of the staff for staying on as long as you did, members of the public, those who did provide comment, and especially to the board members. Morgan, you said it so eloquently. We are volunteers, and we are parents, and we are business patrons, and we want what's best for Boulder County